238 since the International Organism of Health and the Organization of Health started the seminar cycle in May 2020. It's 4 years of continuous interlearning since we started this webinar cycle. Today, it is a pleasure for me to introduce the webinar, Menstrual Health, the Pending Agenda in the Framework of Sexual and Reproductive Rights. In 1971, with the creation of the Hipólito Unanue Agreement, the governments of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela joined with a sense of solidarity and regional integration to make health a bridge for peace and work for the well-being of the Andean population. So, today, the Andean Health Organization of Hipólito Unanue Agreement has an important trajectory of unity and constant work with the ministries of health of the 6 Andean countries toward the realization of the right to health. In the midst of the technological globalization, the COVID-19 pandemic reaffirmed the relevance of the health sector for life with well-being. For this reason, it is now a priority to keep health at the center of the policies and the social awareness to unite for the common good in order to advance in a society that cares for life. Health is a bridge for integration and peace. For this reason, our strategic plan 2023-2030 indicates that to ensure the full realization of the right to health with social and environmental justice, it is key to work intensively in the strengthening of the health systems, emphasizing primary health care. Reflections like this and the summary of the actions that we conduct month after month, you can find all of this in the Notis Salud Andina's newsletter, which is published monthly, and you can find it in the Horas CONU website. It is available there as well as in the Integración Andina knowledge platform. We invite you to leave your name, your organization, and your country in the comments box, both of Facebook as well as the YouTube Live platforms, in which you will find a link and where you would need to fill in a brief survey and leave your data, giving us your email address so that we can send you the certificate for this webinar. To start this important work, I'll give the floor to Dr. Marisela Malguin, Deputy Secretary of the Andean Health Organization, who will give the welcome words and the institutional greeting. You have the floor, Dr. Malguin, please. Thank you, Gloria. Good morning, good afternoon, wherever you are, or depending where you are in this new event. Horas CONU is presenting this webinar on menstrual health, remembering that for centuries, the menstruation has been one of the main taboos, both cultural taboos in all over the world. Because of this, children, adolescents, and women experience one of the lengthiest and important physiological process in context of silence, violence, and discrimination, as indicated by the UN, which negatively affect their sexual reproductive health, their self-esteem, their autonomy in decision-making with regards to their body and sexuality, and the access to educational and job opportunities based on what UNICEF has indicated in 2020. The call of the main international organizations, among them those that belong the UN system and diverse medical societies, is clear. The states must take concrete measures in terms of mental health in order to break taboos, protect the health, and fight the discrimination that millions of girls and female adolescents and women experience at the same time that the health workers and people from other areas should consider the menstrual cycle as an important indicator of the individual and global health. It is in this context that the Andean Organization of Health, Hipólito Unanue Agreement, has considered to approach this important topic in the cycle of webinars that we've been conducting since May 2020. It's more than 4 years now, with the objective to strengthen the access to information around the menstrual cycle from a very extensive approach. This will be discussed by 3 experts in the topic in order to try to continue with the elimination of the social cultural taboos and thus advance in the full realization of the rights of both the children, female adolescents, and women, and all the people in our region. Orascon recognizes that working in this topic, which is critical to achieve a fairer and more equitable health system, reaffirms its commitment to continue working on this. This webinar seeks to join to the efforts that the countries are already doing for the full realization of this right. In this occasion, having for these 3 excellent presenters and speakers who will share their experiences on this very important topic: Dr. Gracia Subiria, Senior Consultant from Peru; Engineer Viridiana Zamora from UNICEF Mexico; and Dr. Ines Garcia from the Rotary Club from Argentina. Welcome you all, and welcome you all the attendees to this event. Thank you. Thank you very much, Dr. Palki, for your words. After your greetings, I will introduce myself. I'm Gloria Lagos Izaguirre. I'm manager of international cooperation of this organization, and I'm also coordinator of the Andean Committee of Comprehensive Health for Adolescents. Today, I'm very pleased to be able to moderate this webinar. Very important webinar, actually. Next, we are going to welcome Dr. Gracia Subiria, a gynecologist with a master's degree in project management and social programs. She is a senior consultant in sexual health and sexual and reproductive rights, with experience in Latin America and Africa. She has a broad experience of work with the Ministry of Health of Peru and international cooperation agencies, including UNFPA, the Regional Office for Latin America and the Caribbean, USAID, and UNICEF. Dr. Subiria has played a key role in advocacy, policy design, and implementation of policies, mobilization of resources, and South cooperation, collaborating with the Ministries of Health, international agencies, and with the civil society in Peru, Nicaragua, Uruguay, and Equatorial Guinea. Always with an intercultural approach in the areas of family planning, prevention of adolescent pregnancy, and maternal health. Her experience includes research studies in sexual and reproductive health, sexual and reproductive rights, cost of health studies, operational research, and evaluation of the impact of policies. In the last few years, she has been dedicated to advocating and designing regulatory proposals in favor of menstrual health in Peru. Dr. Gracia, you have the floor. Your microphone is muted, sorry. Well, thank you very much for such a generous presentation, Gloria. And I want to thank Orascon for giving me the opportunity to discuss this topic and for the dissemination that we will that we will be able to make about this topic in this webinar. Well, good morning to all the participants. I'm going to start my presentation now. I can share my screen, right? Yes, great. Excellent. I'm going to I'm going to close my camera so I will have a better bandwidth, or I can devote my whole bandwidth to my presentation. Well, it seems that I cannot. Let me see. Here we are.
Muy bien. En primer lugar,
Very well
quería
done. Very well.
mencionar
Then,
algunos
first of
temas
all, I would
generales
like
con
to mention
ustedes.
some
En
general
esta
topics that
presentación
I want
me
to
voy a
discuss
referir
with you.
a
In this presentation, I'm
principalmente
going
a
to talk
niñas,
mainly about
adolescentes y
children,
mujeres,
female
pero
adolescents, and
eso,
women. But
digamos, porque son la
these
mayoría de las personas que
because
menstruan, pero
these
no
are
son las
most of the
únicas.
people that
Y
menstruate. However, they are
por eso
not the only
van a
ones, and
encontrar a veces el término
that's why
personas
you will
menstruantes, que
find
ese término
sometimes the
queremos
term uh,
incluir a aquellas
people
personas
that
con
menstruate, and in this
disfasmo,
term we want to include also people
personas
like
con
trans men
opciones
or people
sexuales
with
diversas, pero que
diverse
también
sexual
menstruan
options,
y que
but who
también
also
ameritan
menstruate
nuestra
and
atención.
that also
Una
deserve our
segunda
attention.
aclaración que
Um,
quería mencionar es
a
que si
second
bien
clarification
la
that I wanted to
menstruación es un
mention is that
proceso
even though
fisiológico,
menstruation is a
¿no? Y en
physiological
el cual,
process in which
digamos, la mayoría de las
we
mujeres,
that most
las
of women have,
condiciones
the
en que
conditions
vivimos
in
la
which
menstruación
we
y nuestro
live
ciclo
our
menstrual
menstruation and our menstrual cycle
difieren mucho
are very
en relación a
different
las condiciones de nuestra vida. Es muy
with regard to the
diferente
conditions of our
que
lives. I mean, it is
una
very different
mujer de clase
that a
media en una
middle
zona
middle
urbana que
class
menstrua,
woman in an
que
urban
las
area,
condiciones que
the
afronta
way she
una
menstruates
niña
are very
en
different
entornos
from the conditions
culturales
faced by a little girl
adversos,
in
con
adverse cultural
pobreza en la
environments with
zona rural, en
poverty
la
in
que
rural
enfrenta
areas
una serie de
in which
medios,
there
con
is a
entornos
scarcity of a series
culturales
of
muy
things and with
restrictivos
very
por los
restrictive cultural
estigmas. Y miren, y es
environments
justamente lo
because
que
of
vamos
the
a tratar
stigma
de
and myths.
analizar.
And that's what we will try to
¿Por qué
analyze
un
actually.
proceso
Why a
fisiológico
physiological
requiere de
process
una atención
requires
especializada
specialized
justamente
attention
para
actually
atender
to
todo
try
este
to
entorno que hace
deal
que
with
este
all
proceso
these
se viva de manera diferente? Y
surrounding things that
justamente
make
la
this
idea es que
process to be
con las
experienced
medidas
differently.
que
And the
nosotros
idea is
vamos a
actually that with the
afrontar,
measures
lleguemos a
that
que
we
esto
might be
sea
able to
equitativo para todas.
start
Y un tercer
implementing, we will
punto
make this
que
more
quiero
equitable for
mencionar
everybody. And
también
a third
es
aspect that
que
I want
este
to
es un
mention
tema
as well
tabú
is that this is a
del cual
taboo
no se habla
topic
abiertamente
that
y por lo tanto
most
es
of the people do not
necesario
speak
que
openly
desde los
about. Therefore, it
diferentes
is
sectores
necessary that from the
comencemos
different
a
sectors we start
transparentarlo y abordarlo
making
ya,
it more
hablarlo
transparent and
y
talking about
manifestar
it
los
and
problemas
approaching it
alrededor
and
del
talking
mismo.
about the problems around
En
it.
ese sentido, quiero
In
presentarles
that
el
sense,
temario
I want to
de la
show you
presentación.
the
Vamos a
list
hacer
of
una revisión
contents
de
of
las
my presentation.
diferentes
First, we are going
definiciones
to review the
que ya
different
se están
definitions
manejando,
that are
porque se
managed
tratará
and why it
que
is, because, well, we need
hablemos
to
todos el
clarify
mismo
actually
idioma,
that we
cuál es
need
la
to
situación actual de la salud
speak one same
menstrual a
language.
nivel
We are going to
global
talk
y
about the
voy a poner un foco en
worldwide
la
situation of
región de
menstrual
América
health. I'm
Latina.
going to focus, of course, in
Vamos a
the
revisar los
Latin
avances
American
que
region.
hay
Then we will see the progress made,
tanto en la política, la
both in
abogacía,
terms of
los
the
costos,
policy,
las
the
experiencias que
advocacy,
hay en diferentes
costs, the
países
experiences,
en la implementación de
experience in
modelos
different countries
alternativos,
with implementation
algunas
of
herramientas
alternative
que nos pueden
models,
ayudar
some
tanto en la
tools that
gestión
might
como en la
help us both
programación
in terms of management
para
and the
atender este
scheduling
problema de salud.
to
Y
take care
luego
of
voy
this
a hacer
health
mención
problem.
a
And
algunos
then I'm going
desafíos
to mention
en
some
relación con la
challenges
generación de
related to the
información, evidencias
generation
en
of
el monitoreo de
information,
las
evidence,
políticas
the
que se están
monitoring of the
implementando y
policies
los
that
cuidados que tenemos que
is
tener
being
en el medio
implemented, and the
ambiente.
care that we need to take in
Y
terms of the
primeramente
environment
quiero
as well.
tratar con
One
ustedes
first topic that I
es
want to
la
discuss with
evolución
you
de
is
conceptos.
the
Ustedes van a
evolution of
encontrar en
concepts.
la
You will
literatura
find in the
diferentes
literature
términos que
different
al parecer
terms
hacen
that
mención
seem
a
to
un mismo asunto, pero
mention
no
or refer
necesariamente
to
es
one
así.
single issue,
La
but
primera vez que
it's
se
this is not
mencionó esto
necessarily
en
the
la
case. The first
literatura y
time
en
that
los
this was
medios usó
mentioned
el
in the
término de
literature,
higiene menstrual.
they
Esto fue más
used
o
the
menos
term
entre el
menstrual
2005 y el
hygiene. This was
2010,
between
¿no? Y
2005 to
fue mencionado
2010, and
principalmente
it
por
was
los grupos
mentioned
que
mainly by
trabajaban
the
lo
groups
que es
working in
la agua, saneamiento e higiene,
water,
que por las siglas
sanitation,
en
and
inglés
hygiene, that
el
for
acrónimo es
the
WASH. Y este
acronym in
término lo
English is
vamos
WASH.
a
And
usar a
this
lo
term,
largo de
we
la
will use it
presentación,
throughout my
porque si no usar
presentation
toda
because
la descripción sería muy larga.
otherwise, use
Resulta
the
que más
three
o menos
words,
en
it's going to
a
be pretty
partir
lengthy.
del
Well,
2000
it turns
se
out that
comenzó a
since
promover
2000, more or less, um,
que la retención de la niña en la
there was
escuela y estos
a
grupos
promotion
iguales
of
comenzaron a
trying to
mejorar las
retain
condiciones de
children,
higiene
girls in
en los
school, and these
colegios
groups of
y
working on WASH
encontraron
started improving the
que la menstruación
management of hygiene in schools, and they found
generaba
that menstruation
ya
generated
una
more
falta de
like a
asistencia
lack of assistance,
de
so
las
to say,
niñas al
of
colegio.
girls or
Entonces ellos
lack of
comenzaron a
attendance, sorry, of
utilizar
children to
para
school
caracterizar esta
because of
situación el
menstruation. So to
término de higiene
characterize this
menstrual.
situation, they started using the term menstrual
Posteriormente,
hygiene.
en el
Later on,
2012,
in
la versión nueva
2012,
de higiene
They were not
menstrual
talking any
y la
longer about
retención
menstrual
de la higiene
hygiene, but they were
menstrual,
talking
cuyas
about
siglas
management
en
and
inglés son
menstrual hygiene. In
Menstrual
English, the
Hygiene
acronym
Management,
is menstrual
MHM. Por
MHM,
favor, quiero que
menstrual hygiene
retengan
management. Please
estas cifras
remember
para
that's
porque vamos a
about
ver
these
que
figures because
posteriormente
we
se
will see
comenzó a
later
hablar
on that they
de la
started talking
gestión de la salud
about the
menstrual, que en
management
inglés
of
tiene las mismas
menstrual
siglas.
health, which in English has the
Menstrual
same
Health Management.
acronym, menstrual health
Esto lo
management.
menciono porque van ustedes
I
a
mention this
encontrar
because
que
you
en la
will find
literatura
that in the
se
literature,
utilizan estos dos
they
términos
use these two
de manera
terms
indistinta, pero no lo es.
interchangeably,
Luego
but
vamos a
they are
revisar
not
en la
interchangeable
fórmula
really. And then later on,
acción
we
de cada
will
uno de ellos. Pero
um,
tengan ustedes en
explain
cuenta
what do
que
we refer with each
MHM
one of them.
en
But
inglés
please bear in
significa
mind that
tanto
MHM in
manejo de la
English
higiene
means
menstrual
both
como
menstrual
manejo de la
health
salud menstrual.
management as well as
Frente a esta confusión,
mental
luego
menstrual
una
hygiene
revisión
management and
y
menstrual
estamos hablando
health
en
management
términos
both.
de salud menstrual.
After that, they made
Y
a
vamos
review
a
of this and
revisar
they started talking
exactamente a qué
about
nos estamos
menstrual
refiriendo con
health.
esta
And we will
definición que les
later on
menciono.
will
Otros
look at this
términos han
specific
salido
definition, menstrual health.
posteriormente a esta
There
definición, que es la
are other
pobreza
terms
menstrual
that
o
have
pobreza del periodo
been coined
y
after this:
menstruación digna o
menstrual
gestión
poverty or period
menstrual
menstrual,
digna.
and
Todos estos
dignified
términos hacen
menstruation
referencia
or dignified
más o menos al
menstrual
mismo
management.
concepto,
All of these
pero
terms make
quisiera
reference to
que
almost the same concept, more or less the
revisemos
same concept, but
en
I would like
particular
us
los dos que
to
cuentan con una
review in
definición
particular
de
the two
grupos
of
específicos.
these that have
La primera
a definition
definición
for
de
a
gestión de
specific
la
groups.
higiene
The first
menstrual
definition, management of
nació
or
a
menstrual
raíz
health
de
management,
en el
menstrual
momento en que
hygiene
se estaban
management,
discutiendo los Objetivos de
was
Desarrollo
coined
Sostenible.
when the
Y
Sustainable
ustedes van a
Development
ver que
Goals
esta
were
definición
discussed at that
está en
time.
términos
And
de
you will see
resultados
that this
porque
definition
se
is in terms of
promovía
goals,
en ese momento
because at that
que
time, what
hubiese
they
un
were
indicador
promoting is that there should be
de
an
atención de la
indicator
salud
of
o de la gestión de la higiene menstrual. Entonces, en ese
ma
momento, esta definición
menstrual hygiene management.
abarcaba
So at
tres
that time, this
aspectos
definition covered three
importantes.
aspects, three
Primero,
important aspects.
que
First,
para
that
conseguir una
in
menstruación
order to
saludable y
have a
digna,
healthy and
¿no?
dignified
Las
menstruation,
mujeres y las niñas usan
women and
materiales
children
para absorber la
use
menstruación y
materials to
adecuados,
observe the
estos
menstruation that
pueden
are
ser
materials
cambiados
that
con
are
la
clean and
frecuencia que sea
adequate and
necesaria
that need
y
to be
tengan
changed in the
acceso
necessary
a
frequency, and they should
condiciones
have access
para lavar el
um,
cuerpo
to
en instalaciones de privacidad con agua y
facilities
jabón
to
y que los
wash your
productos
bodies with
reutilizados puedan
soap
ser
and water,
reciclados
and
de
that
una
the
manera
products that have
adecuada.
been used
Que
can
también
be
cuenten con
disposed of
información
in an
pertinente
adequate
aspectos,
manner, and also
información relacionada con los
to
aspectos
provide them
básicos de
with
la
information
menstruación, ¿no?
about
Y
the
que
basic
puedan
aspects of
gestionar
menstruation so that
la
they can
misma de manera
manage
adecuada
their
sin
menstruation in an adequate
temor a
manner without
molestias.
fears and without
Esta es la
discomfort.
definición, la
This
primera
is
definición
definition,
que
the first
tenemos de una
definition
manera
that we
conjunta
have,
entre la OMS y
a
UNICEF.
joint definition between the
Posteriormente,
WHO and UNICEF. Later on,
hubo una reunión de
there was
expertos
a
en
meeting of
los años
experts
2021
that
frente a
was
esta
in
diversidad de
2021
definiciones. Se
vis-a-vis this
juntaron
diversity of definitions,
representantes de la academia,
representatives of the
investigadores de las
academia,
agencias de
researchers
cooperación,
from the
de los
cooperation
16 países
agencies,
de los 4
people from the
continentes
different
y en una
countries from the four
reunión
continents joined
revisaron
together.
toda
And in a
la
meeting, they reviewed
información que
all
había
the
en
information
relación al
that
tema,
they had with
las
regards to
diferentes
this topic,
definiciones que
the
habían
different
de derechos
definitions that
sexuales y reproductivos y de salud y
there were
llegaron
about
a la
sexual and
siguiente
reproductive
definición de la
rights and
salud
health,
menstrual.
and they reached
La
the
salud
following
menstrual es un
definition
estado
of
completo de
menstrual health.
bienestar
Menstrual health
físico,
is a
mental y social y
full
no la mera falta de
condition
enfermedad,
of
todo lo que respecta al
mental
cuerpo
and
menstrual.
social and physical
Para
well-being, and
alcanzar una
not a
salud
mere lack
menstrual
of a
es
disease
necesario
in
que las
what refers to the
personas en
menstrual
relación
cycle. To
accedan a
reach menstrual health, people that menstruate
productos para
need to have access to
gestionar la
products
menstruación
to manage
asequibles en
menstruation,
términos de que puedan
affordable
acceder
products
y no haya barreras de
for
costo,
menstruation, not
geografía,
that
en
is not
fin,
having barriers of cost,
todo
geographies,
tipo de
or
barreras,
whatever,
que
or any
ellas
type of
puedan
barrier.
decidir
They should be
libremente
able to
durante la
freely
menstruación
decide
y
during
participar en todas
menstruation
las
if they want
actividades
to participate
cotidianas
in all the
en las diferentes
day-to-day
esferas de su vida
activities
y
in the
puedan
different
acceder a
spheres of their
información
life, that they
adecuada y
can access to
oportuna en
adequate
relación a
and
la salud
timely
menstrual
information with regards to the
y
menstrual
viven en un
cycle.
entorno
They need to
positivo y
be able to live in
respetuoso,
a
libre
positive
de
environment
estigma
and
y
respectful environment,
discriminación
free of stigma
y
and
diferencias,
discrimination that
contar con
might generate
baños
stress for them. They should
con
have
condiciones de
toilets
privacidad,
with
agua y
conditions of
jabón, acceder
privacy, water,
a
and sewage,
diagnósticos y
and
tratamientos
access to
oportunos en caso
diagnosis
que
and
haya
timely
molestias,
treatments in
molestias
case
o
there
trastornos
is any
asociados a la
discomfort
menstruación.
or disorder associated to
Entonces, esta es
menstruation.
la
So
definición que
this
nosotros
is the
consideramos que es la
definition that
más
we
completa e
consider is the
integradora y la que
most
vamos a usar
comprehensive
de
and
aquí
the
en
one that we will
adelante en
use
esta
from now
conversación.
on in this presentation.
Como vemos, de acuerdo a
As
las
you can see,
definiciones, el
based on the
término
definitions,
menstrual
the
está
term of menstrual
asociado
health is
íntimamente a los
associated
derechos de las
very
personas,
closely to
a los
the rights
derechos
of people,
de salud sexual y reproductiva,
the
a los
sexual and
derechos
reproductive
de
uh,
poder
rights, the right
hacer
to
todas
be
las
able
actividades
to
que uno desea,
conduct
cuando las
all the
desea,
activities that
¿no?
you
Sin
want
ningún
to
tipo
do
de
whenever you
restricción.
want to do them without any type of
Entonces vemos
restriction. So
que
we can
la
see
salud
that
menstrual está muy
menstrual health is
relacionada
very
al
much
logro de una serie
related
de los
to the achievement of a
objetivos de
series
desarrollo
of
sostenible. Si bien no
Sustainable
fueron
Development
incluidos,
Goals. Even
sin
though they were
embargo,
not included,
hay dos
however, there are
indicadores que
two indicators that
son
are
utilizados
being
para
used
monitorear
to monitor
las condiciones en las cuales la
the conditions in
menstruación
which
está
menstruation
ocurriendo
is
en
happening
la mayoría de los países,
in
sobre todo en
most of the
desarrollo, y
countries,
que
especially the
tienen que ser
developing countries, and
modificados. Y estos
situations
son
that need to be
dos
modified, of
indicadores
course. These
claves.
are
Uno
two key
está
indicators. One
relacionado o
is
es igual,
related
que es el
to
indicador 4A,
the Sustainable
que refiere a la
Development Goal
proporción de escuelas
4A,
que
which
tienen acceso a
refers to the
instalaciones
proportion of schools
sanitarias
that have
básicas
access to
separadas por sexo,
basic
es decir, que
uh,
existen baños para
sanitation facilities
mujeres y baños
separated by
para
sex, that it's a
hombres, y
toilet for
que
men,
estas
toilet for women,
instalaciones
and that these
cuentan
facilities
con las
should
condiciones
have
básicas
the
para
basic
poder
conditions to be able to
lograr un aseo de manos, ¿no?
wash
Adecuado de
hands
acuerdo a la
based
definición
on
del
the
indicador de wash.
definition of the
Y el
wash
otro
indicator.
indicador
And the
se
other
refiere a
indicator
lograr el acceso a
refers
servicios
to
de
achieving
saneamiento
access to
adecuados y equitativos para todos y
adequate and
ponerse
equitable
para el derecho a la vida
sanitation
libre.
and hygiene
Prestando
services
especial
to
atención a las mujeres, edades,
eliminate
mujeres pequeñas, personas en
open
situación vulnerable.
open
Estos
area
son los dos
defecation.
indicadores que se están
These are
usando
the two
para
indicators that are
monitorear
being used
la
to monitor
implementación
the
de
implementation
políticas
of
y que mejora las
policies
condiciones
and
que
that
enfrentan las mujeres bajo
will improve
menstruación.
the
Sin
conditions that
embargo, esto no
women
quita que
face when they menstruate. Obviously,
ODS
this
como los
doesn't mean
relacionados
that
a salud,
SDGs, such
y
as
hay
those
en
related to health,
específico
and
en
there's
el
one
ODS3 y en
specific
el
in
ODS5
SDG 3
ODS,
and 5
que tienen las mujeres
also
derecho a acceder
that
a
mention the rights
servicios de
of
salud
women
sexual y
to have
reproductiva.
access
Y
to
por otro
sexual and
lado, también
reproductive health
vamos a ver
services.
que
And
hay
on the
una
other hand, we will
ligación
also see
con lo referente al medio
that there is
ambiente
also a
y
relationship with
los
the environment
productos de gestión
and
menstrual.
the
¿Cómo
menstrual
estamos en,
health
vamos a hacer
product.
un análisis, perdón,
So now
en
we are going to do
por
an
cada uno de
analysis
estos
with each
determinantes que
one of
están
these
asociados a salud
drivers that
menstrual,
are
una
associated to
rápida
menstrual
revisión
health.
de cuál es la
We're going to
situación
review rapidly
actualmente.
which is the current situation.
Cuando hablamos de acceso a los
So
productos de
when we
gestión
speak
menstrual,
to access to
vemos
menstrual health
que
products,
hay
we can
diferentes
see that
categorías.
there are different categories, right?
Tenemos
We
aquellos
have
productos que son
those products that are
adecuados para la gestión
adequate
menstrual. Eso es lo que
for
llamamos nosotros
menstrual
productos
health,
ad hoc.
what we
¿Qué
call ad
tenemos por
hoc
esto?
products.
Entendemos
What do
que
we
son
mean
las
with this?
toallas
Well, that these
higiénicas
are the
descartables,
pads, menstrual pads,
los tampones, por ejemplo, pero tenemos
tampons, for
aquellos
example.
productos que son
Then we have
reutilizables,
those
donde
products that can be
entran, por ejemplo, aquí las toallas
reusable,
higiénicas
like, for
reutilizables,
example, reusable
la bata
pads,
menstrual,
the menstrual cup,
las truzas,
the
también adecuadas para la menstruación.
and
Hay una nueva
other
categoría que me
adequate
parece
products,
interesante que se está
reusable products.
comenzando a
There's another
registrar y
category that
es
seems to be
el
interesting
uso
for me that it's
parcial. ¿A qué nos referimos con el
being
uso
started to use,
parcial?
and it's partial
Es
use.
aquellas
What do we mean with partial use?
mujeres o personas
This means
menstruantes que
or
están
refers to
usando,
those
por ejemplo,
women
algún
that are
producto
menstruating that are
adecuado,
using, for example,
pero
an
no lo
adequate
usan
product,
durante
but
todo
they
el
do not
ciclo
use it
menstrual,
during the whole
sino
menstrual cycle. But
en parte del ciclo
in
utilizan
part of the cycle,
productos
they
ad
use
hoc,
products
pero
that are ad
parte de la
hoc products,
menstruación,
good
por
products, but
diferentes
in part
razones,
of their
principalmente
cycle,
pueden
menstrual
ser
cycle, for
económicas,
different
usan
reasons,
productos
mainly
que no
economic
son
reasons, they
los
would
más
use products
adecuados
that are
para la
not the most
menstruación o
adequate for
prolongan
menstruation
más
or that
allá de
will
lo
prolong
recomendable el
uh,
uso de los productos adecuados. Y
the most
finalmente
beyond what is recommendable,
tenemos
the use of
el
the
uso
adequate
de
products. And
productos no
finally, we have the
adecuados,
use of
¿no? Como
non-adequate
son
or
el uso
inadequate
de
products, like the
cartón,
use of
papel,
cardboard, paper,
trapos
um,
y otros
pieces of
materiales que
clothes,
están descritos
or
ya
and
en
different
algunos
materials that
estudios que
have been
utilizan
described in some studies
las personas
that are being
menstruantes.
used by
Vemos, por ejemplo,
menstruating
que en los
people.
países
We
de
can
los
see, for
ingresos bajos,
example, that in the
¿no?
low-income
El
countries,
65% de las mujeres
65% of
usan
women use
productos no adecuados y
inadequate
solamente
products,
el
and
treinta y
only
cinco por ciento
35% of
utiliza estos
them
productos. En
use
países de
adequate
ingresos
products. In
bajos y medios,
low
el
income and
porcentaje de
medium
mujeres que
income
utilizan
countries,
productos
the
adecuados es
percentage of women
62,
using
pero
adequate
sigue
products is
habiendo
72,
un
but there
porcentaje
is
alto
still
de
a high
28% de
percentage of
mujeres y productos que
28% of
usan
women
productos no
that are
adecuados.
using inadequate products still.
Si llevamos esto a
If
números
we take
absolutos,
these to absolute numbers, we
tengamos en
will
la
be able to
mente
see,
que
or we should
mensualmente
bear in
hay
mind that
2.000 millones
there are
de
2
personas
billion
menstruantes.
people menstruating.
78% de ellos usan
78%
productos
of
adecuados,
these
pero hay
people
un
use adequate products, but
22%
there's a
de mujeres
22% of
que
women
utiliza productos no
that
adecuados. Y
use
estos son más o
inadequate
menos
products, and this is around
387 millones de personas.
397
Sin embargo, nosotros
million
sabemos
people.
que estos
However, we
promedios
know that these
ocultan
averages
grandes diferencias. Y
hide
por ejemplo, en la
great
India,
differences.
no vemos
And
que
for
el
example, in India, we see
67%
that
de las mujeres usan
67%
productos
of women
adecuados
use
y
adequate
solamente
products,
el
and only
32% de las mujeres en las
32% of
zonas
women
rurales
in the rural areas
utilizan
use
productos adecuados para la gestión
adequate products
menstrual. Es
for
decir,
menstrual health.
probablemente
That
si
it's
hacemos un
probably, if
análisis
we make an
entre la
analysis
población rural y la
between the rural
urbana,
population
estos
and the urban
números van a
population,
ser muy diferentes, sobre
these
todo
numbers are
en
going
los
to be very
países
different,
de
particularly
bajos ingresos
in the low
o
income countries or
ingresos medios.
middle income countries as well.
¿Cómo estamos en América Latina?
How are we doing in Latin
En América
America?
Latina,
Where in Latin
8.5
America,
millones
8.5
utilizan
million women
productos no
use
adecuados. Si además
non-adequate or
sumamos
inadequate
los 12
products. If
millones
we
de mujeres que
also add the
utilizan
12
pero
million
no uso
women that use
parcial de
or that
estos
make a
productos,
partial
es
use
decir,
of
no
these
todo el
products,
tiempo
that is,
acceden
they
a
do
los
not use
productos
them all
adecuados
the
para la
time,
gestión
they do not have
menstrual,
adequate products all the
vemos que hay
time, we
21
can see that
millones, es
there
decir, el
are
13% de
21 million, that
mujeres
is
en América
13%
Latina,
of women
no
in
están
Latin America
accediendo
that are
a
not having
productos de
access
gestión menstrual
to
adecuados. La
adequate
barrera más
menstrual
importante
health
para esto
management
es el
products. The most
costo.
important barrier
Vemos
for this is
nosotros
cost.
que,
We
por
can see
ejemplo, un
that,
paquete
for
de toallas
example,
higiénicas o
a
sanitarias
package
en
of
la región es el
hygiene
equivalente a un
pads
kilo
or
de frijoles
menstruation pads in
o
the
de
region is
arroz.
equivalent to 1 kilogram of
Un
beans
almuerzo
or a
es el
lunch,
equivalente al
or the
costo de un
equivalent to
refrigerador.
the cost of
Nosotros
a
conocemos en la
notebook.
región
We know
la
in the region
escasez
the
de algunos
scarcity
grupos de
of
pobreza y pobreza
some
extrema y podemos entonces
poor and
imaginar lo difícil
extremely
que
poor
puede ser
groups,
para esta
how
población
little money they have, and
acceder
we
a
can
productos de
understand how
gestión
difficult
menstrual.
it is for these
Y
kinds of
las
populations to access
condiciones,
this kind of menstrual
lo que
hygiene
esto
products,
condiciona,
and
¿no?
what
Para
the
ver
conditions that
cómo
this
ellas
creates
viven la menstruación.
to see how do they live
Si
their
vemos cómo
menstruation.
estamos en el acceso a
If
agua y
we see how are we
saneamiento,
doing with access to water
estos
and
son datos
sanitation,
del 2015,
this is
¿no?
data from 2015, by the way.
4.500 millones de personas en el mundo carecen
4,500 million
de
people,
una
4.5
posibilidad de evacuar
billion
después de
people in the
defecar, es
world
decir, no
cannot
tienen un inodoro,
defecate in their
probablemente no
households, in their
tengan un
homes. They do not
baño
have
en
a
su casa.
WC or a toilet in their homes.
892 millones
892
defecaban al aire
million
libre
were
en el 2015.
practicing open defecation in
Esta cifra ha
2015.
bajado a
This figure has
494
gone
millones
down
en
to
el 2020. Hay unas
494 million in
verdades.
2020. Uh,
Las cifras a lo largo de
to
los
tell
años
you the
han
truth, the
bajado
figure during the years are
sustancialmente, o sea,
going
la
down
población que defeca en el
substantially.
aire,
That is, the
¿no? Y
people
esto,
that use open
imaginémonos que
defecation
una
is the
persona
number is
defeque en el
decreasing. And
aire
let's
en
imagine this:
mismas
as a person
condiciones,
defecates
va
in
a
the open air,
encontrar, o sea, no condiciones apropiadas cuando
they
una
won't
chica
have
está
the
menstruando
same
y
conditions will be
quiere
applicable when a girl
cambiarse
is
la
menstruating and she
toalla
wants to change
higiénica
the pad,
o quiere hacerse el
the
aseo. Esas
or
son las
wants to clean
condiciones
herself.
que
Those
tiene que
are the
afrontar
conditions that they have
esta
to deal
persona
with, these
cuando no tiene
girls,
un
when they
espacio
do not
privado o
have
no
a private
tiene
space, or they do not
agua y
have water
saneamiento
and
en su casa
sanitation in
o en
their
un
homes, or
baño cercano.
in a nearby
Y esas son las
toilet.
condiciones en las
And
que ellas
those
se
are the
encuentran.
conditions in which they live
Desgraciadamente,
their
la
menstruation.
defecación al aire
Unfortunately,
libre es una práctica
open
todavía
defecation
bastante
is a
extendida
practice that
en
it's
varios
still pretty
países de la región.
extended in several
En Haití,
countries of
por
the
ejemplo,
region.
esto
In
llega a
Haiti,
ser
for example,
el 20% de la
um,
población
this
tiene
is
que
20% of the population. 20% of the population,
vive
they
en
have
estas
to
condiciones.
live under these conditions. They have to practice open defecation.
¿Cómo enfrentamos las mujeres la
So how
falta de
do we
información?
women
Imagínense que
face
hay
the lack of
estudios
information?
en la
Well,
región
there are
que
studies done in the
refieren que
region
entre el
which
10 hasta
indicate
el
that 10 to up to
70% de las niñas
70%
no
of
contaban con
girls
información cuando menstruaron
didn't have
la primera vez. Esto,
information when they
imagínense una
menstruated for the
niña de
first time. They
10,
didn't
11
have any
años
information. So
que no
imagine a
tiene
girl, 10,
información
11
y
years, that doesn't have
comienza
any
a
information
sangrar
and starts
por sus
bleeding.
genitales.
through her
¿no? La
genitals.
impresión que eso
The
le puede
impression that
generar
this
de
might
susto,
generate to her the fear,
angustia,
the anguish.
muchos estudios reportan la
Many
impresión como
studies
que
report this.
pensé que
It's that they say like I thought that I
estaba
was
que
sick.
se me
I thought that
había
I
roto algo,
something
que
has
me iba a
had
morir.
broken
Esas
inside me. I thought that
impresiones
I was going to die. Those
mencionan
are
estas niñas
the
cuando se
expressions that
enfrentan a
these
la
girls
menstruación
mentioned when
sin
they
tener
have to face
información.
menstruation without
Los
having any
niños
prior information.
también y los adolescentes
Boys and
refieren
adolescents,
conocer
male
muy
adolescents,
poco sobre el
also
ciclo menstrual. Para
mentioned that they
algunos
know
es
very little
algo
about this
sucio,
menstrual
otros
cycle. For
refieren
some of them, it's a
que esto es una
dirty thing.
enfermedad,
Some
pero no
others refer
tienen
that this is a
conocimiento.
disease,
Sin
but they do
embargo,
not have any knowledge. And
manifiestan el
however,
deseo de contar con información.
they mentioned that they wish they could have more information.
En una encuesta realizada
In
sobre
a
el
survey
régimen
conducted
menstrual en Buenos
on
Aires
menstrual
en el
management
año
in Buenos Aires
2020,
in
no,
2020,
50% de las
50% of
niñas y
the
adolescentes encuestadas manifestaron
respondents, girls and
que la
adolescents,
mayor
they
parte de la
mentioned that
información sobre el ciclo
most of the
menstrual
information
la
on the menstrual
obtuvieron de las
cycle,
redes
they got it
sociales.
from the social
Solo el
media.
10%
Only
la
10%
obtuvo
of
en
these
la escuela.
girls and
Estamos hablando de
uh,
una ciudad como
girls
Buenos Aires,
obtain
que
this
tiene
information in the
acceso a
school. And
Internet
we are talking about a
bastante
city like Buenos
difundido,
Aires that has
pero si en
access
una
to
ciudad como
internet and
esta
everything. But if in
la
a city like
información
this,
que,
information
perdón, la información que creo que he dejado de compartir, no,
is my
ya,
screen. Can you see my screen?
la
Yes, it's okay.
información que
Yeah. So if in a city like this, the information
requieren no la obtienen de los
that
colegios, muchos
these
padres
girls
también
require do not
mencionan que no han
get it
sido
from schools,
entrenados
and
para
many
ello.
parents also mention that
Entonces,
they have not been trained
realmente
for
la
this.
información que
So really,
manejan
the
estas niñas y
information that these
adolescentes es
girls and
bastante
adolescents
pobre con
manage is very
respecto
poor,
a
very, very
la
reduced
menstruación en sí y
with
los
regards
cuidados
to
que tienen que
menstruation
tener.
and the type of care they need to have
Revisando el
when
tema
they
de
are menstruating.
tabú y
Now,
estigma,
talking
por
about
ejemplo,
taboos and
el estudio
stigma,
que
for example,
señala
there are
que
studies that indicate
en Egipto,
that
por
in
ejemplo,
Egypt,
las niñas no se bañan
girls,
durante
they
la
do not
menstruación
bath
porque
while
consideran
they are
que es
menstruating
un
because they
tabú
consider that it is a
entrar
taboo
en contacto con
to
el agua
enter
durante la
in
menstruación.
contact
Y
with
esto lo
water while
encontramos
menstruating. And this
me
we
parece que en
find,
muchas de las
I
regiones,
think that in
¿no? En
many of
América
the
Latina, acá vamos a
regions in
mencionar
Latin America,
de no
here as well.
bañarse,
For
no lavarse
example,
la
this
cabeza, no
thing of
limpiar el
not
bazo con el agua corriente ni
bathing, not
subir,
washing
y al
their head,
contrario,
not
este es un
entering into
momento en
contact
el
with
cual
water.
sí
It's really,
tenemos que tener
it's something very
cuidado
much disseminated,
de
and
bastante higiene
we
en esa
have to
zona
be very
sanitaria.
careful, actually, and to
Algunas
explain that there needs
comunidades,
to
como en
be
la India, por
good
ejemplo,
hygiene in the
ofrecen a las
genital areas.
niñas
In some
una
communities
serie de
in India,
actividades, no
some
pueden
women are
participar de las
restricted from
actividades
many activities.
cotidianas
They cannot
religiosas.
participate in their
En
day-to-day
algunos
activities or in the
espacios
religious activities. In
eh,
some
se les impide
spaces,
entrar,
they
¿no?
are
Porque
even
consideran la
forbidden
menstruación
to
como algo
get to
sucio.
these meetings or religious meetings because
También
they
las
consider
mismas
menstruation as something
refieren
dirty.
que sus compañeros
Girls
se
also refer
burlan,
that
¿no?
their
Si
classmates,
es
the
que se dan
boys,
cuenta y les hacen
joke
bromas entre
about
comillas,
them
como estamos mencionando acá,
uh,
porque
if they realize that they are menstruating,
consideran, también lo consideran algo
because they
como
also consider
sucio
menstruation as
y no
something
entienden la
dirty,
situación
and they
o
do
su
not really
mensaje es
understand the situation. They are
confuso
not
porque
empathetic
justamente
with
no se
their
ha trabajado
girl
esto con ellos.
classmates because this hasn't been worked with them
Vemos que
really.
la menstruación, por ser un problema fisiológico,
We see that
¿no?
menstruation,
Se ha
being a
normalizado
physiological problem,
que lo vivamos
it has been normalized that we
con
live it
determinadas
with
características. Y, por
certain
ejemplo,
characteristics.
la dismenorrea,
And for
que como
example,
mencioné es un
dysmenorrhea,
tema
as we
bastante
will see,
frecuente que
it's a very
en algunos
frequent thing that
estudios
in some
encontramos
studies we have
tan
found that
frecuente como
it's
que el
as frequent
71% de
like
las mujeres de diferentes
71% of women
países,
from
y
different
no
countries.
importando la condición
And it doesn't
socioeconómica o el
matter,
nivel
regardless of
de
the
educación que
socioeconomic
tengan, la
condition or the
presentan,
level of education they
puede
have.
ser un efecto
It
limitante, tanto es así que el
they have
20% de estas
dysmenorrhea, and it can be a limited
mujeres
limiting effect. And
no asisten a
so
clases por el dolor que les
20% of these
representa,
women
y el
mentioned that they do not
40%
attend
refiere
classes
que
because they are very
el
painful
estar
during those days,
con la
and 40%
menstruación y
mentioned that
con cierto nivel
having
de dolor
menstruation and
afecta
certain level of
el nivel de
pain
concentración.
affects
Sin
their level of
embargo,
concentration. However,
este dolor ha sido
this pain
totalmente
has been totally
normalizado y no
normalized
atendido en
and
muchos sistemas de
hasn't
salud.
been taken care of in
Yo he
many health
encontrado acá en
systems.
Perú que, por ejemplo,
I have
el
found here in
paquete
Peru, for
de
example, that
atención básico de salud
package of basic health care,
establece los problemas que deben ser
which
atendidos por los seguros,
establishes the
tanto el
conditions that
Seguro
need to be
Integral de Salud, que es el
covered
seguro
by the
del Ministerio de Salud,
insurances, both in
no
the
considera
comprehensive health insurance
prestaciones
of the
para
Ministry of
atender
Health.
la
It doesn't
dismenorrea ni
consider
los
anything
trastornos del ciclo
to take
menstrual. Y
care of
me parece que
dysmenorrhea
este es un tema
or the
común, porque se ha
affections
normalizado
or the problems of
que
its
los
menstrual cycle. And I
problemas
think that this is something
asociados a la
common
menstruación
that because it's
no
been
requieren
normalized
una
that the
mayor atención de nuestra
menstruation related
parte.
problems do not require more attention or
También la
care
salud
from our part.
mental se ve
Mental health is
afectada
also affected
por la desatención de la salud menstrual,
because of not
¿no?
taking good
Por
care of the
ejemplo,
menstrual
muchas
health. For
niñas
example,
pueden
many girls
no buscar atención médica oportuna
may
justamente
not look
porque
for
hay
timely
tabús,
medical care because
vergüenza
there's
de
taboo,
acercarse
they are
a un
ashamed
establecimiento de salud
of getting
por
to
las
a health
molestias que pueda presentarse.
facility because she's having discomfort or
¿Qué
problems with
impacto
menstruation.
tiene en la
What
salud
impact does this have
física y mental
in
la no
the
atención
physical and mental
de la
health? What
salud
is the
menstrual
impact
y
of
de estos
not taking care of
factores
the menstrual
que
health
hemos
and
visto que
these
están
factors
asociados
that
a la
we have
salud
seen that
menstrual?
are
La
associated to
falta de recursos
menstrual
económicos
health?
y la
Well, the lack of
información
economic
en las
resources
empresas,
as
por
in, and
ejemplo, puede
information
dar lugar a
in
una
mental
opacidad
health, for
de los
example,
productos
might
sanitarios, a
lead
una
to
higiene de la zona
a
inadecuada, lo
prolonged
que
use
aumenta el
of
riesgo de
the
infecciones en el aparato
menstruation
genital. El
products
lavado
and
inadecuado de
an
manos, por
inadequate
ejemplo, luego de
hygiene in the genital
manejar
area or the inadequate
el
hand
producto de
washing,
la
for
relación
example,
sexual
after
después de que lo hemos utilizado y
after
no
using the
hacemos un
product
lavado
of
adecuado de
menstrual
manos,
hygiene. And if
puede
we
estar
get rid of the
asociado a
products or we
infecciones
use
como
the
el
products and we do not wash
hepatitis
our
genital.
hands correctly, this might be
Un
affected to
estudio en
infections like
Kenia,
hepatitis
lamentablemente,
B and
encontró
candidiasis.
que la
A study in
falta
Kenya
o
showed
la
that the
imposibilidad
lack
de acceder a
or the
toallas
impossibility
higiénicas
of
estaba
accessing to
asociada a
menstrual
sexo
pads
transaccional
was
para poder adquirirlas.
associated to transactional
Las
sex to be able
experiencias
to buy them.
negativas
The
alrededor de la
negative
menstruación, por ejemplo, como
experiences around
mencionaba el caso de
menstruation, like
las
for
niñas
example,
que
the thing that I
comienzan a
mentioned,
menstruar
the
sin
girls
tener
that
la
start
menor
menstruating
información,
without having any
estas
information
experiencias
about this,
negativas
these negative
asociadas
experiences
generan
associated
vergüenza,
generate
falta de confianza en uno
shame,
mismo,
lack of
angustia,
confidence
¿no? Por el
i-
entorno,
in one
digamos, poco
person in
empático que puede
themselves,
haber, por
and
ejemplo, en la
anguish
escuela,
because
en
of
el
the little,
trabajo,
very
puede provocar
little
ansiedad e incluso en
empathetic
muchos casos
environment in
puede
schools
llegar
or
a
in
la
society, and
depresión.
it can even lead to
El
depression in
impacto
some
en la
cases.
educación, por ejemplo, se ha visto
The impact in
que la
education has been,
falta
we have seen
de
that the lack
productos
of
para atender la
products
menstruación,
for
las
menstruation,
instalaciones
inadequate
inadecuadas de los
facilities,
baños, con falta de privacidad,
toilets
de un
without
seguro
privacy,
que pueda tener un
or
cierre
a lock to be able to
que
lock
permite el
in the
ingreso de otras
toilet so that
personas,
nobody
la
else
falta de
enters,
agua,
the lack of
puede
water in
llevar a que las
toilets, all
niñas
of that
no
might lead
vayan a
to
clases. En
girls
Kenia, por
decide
ejemplo, esto
not to
ocurre
go
en
to
el
classes. In Kenya, this
95% de los
happens, for
casos.
example, in
Las niñas no
95% of the
acuden a la
cases,
escuela, no
girls
acudían a la
do not
escuela
go
durante
or
la
were not
menstruación,
going to
lo que
school
puede llevar
during
justamente a la
menstruation, which
larga
also
a la
can lead in
interrupción de
the
la
long run
escuela,
to the
a la
interruption
pérdida de
or
clases y
abandonment of
finalmente el
school, of
abandono,
losing
con las
classes, and
consecuencias que
finally
todos
abandonment
sabemos
or dropout,
que puede
with the
tener cuando una
consequence
niña
that we
abandona la
know
escuela, como es el embarazo, por
that
ejemplo,
might
a
come
adolescentes.
when a girl abandons school because for different
La
reasons. For example,
limitación
teen
de estos
pregnancy.
productos y las
The limited
tabús
access to these
alrededor
products and the
pueden
taboos
generar
around them
problemas de
might generate
concentración, baja
also problems of
autoestima
concentration, low
y, como ya
self-esteem,
mencionaba,
and as I
¿no? La
had already
falta de
mentioned, the lack
actividades
of
extracurriculares,
activities,
todo ello
extracurricular
puede
activities,
afectar
all of that
el
can
rendimiento escolar.
affect
En
the
América
school
Latina,
performance. In Latin
diferentes
America,
estudios
actually, different studies
en México, en
in
Colombia,
Mexico,
Perú,
Colombia, Peru,
refieren que más o menos un
refer that
30% de
around
las niñas
30% of
menciona
girls
haber
mention
faltado de
uh,
1 a 2 días
that they
durante su
have
menstruación.
missed 1 to 2 days of school during their menstruation.
¿Cuál es la población con mayor necesidad
So what is the
para
population that
atender
is more in need
la salud menstrual?
to take care
La
of
población
menstrual
rural,
health? Well, the
pobre,
rural
indígena y en
population, poor
situación de
indigenous population,
discapacidad.
and
Los hombres
the
trans y las
disabled
personas
population,
sexodiversas
trans
pueden
men and
experimentar sentimientos de
diverse
disforia de género
people
y
might
este se
experience
puede ver
having senses
exacerbado
of or
por la
feelings
falta
of
de
gender
condiciones
dysphoria,
para
which might be
manejar la
exacerbated because of
menstruación.
the lack of
En
conditions to
situaciones de
manage
emergencia y
menstruation.
crisis
In
humanitaria,
situations of
también las
emergencies
mujeres
or
y las niñas
humanitarian
quedan
crisis,
especial
women and
situación de
girls
vulnerabilidad
in
por todo
a
lo que hemos
vulnerable
mencionado.
situation are also very affected
Hay un
by
impacto también
all the things that
importante
we
de
have
los
already mentioned. There is also an impact of
desechables
the
durante la menstruación en el medio
products, the use
ambiente.
of products
Estos
during
productos
menstruation and the
no son
elimination of them into
biodegradables.
the
Consideramos que
environment.
una
These products are
mujer
not
utiliza
biodegradable.
entre
If we
10.000
consider
y 13.000
that a woman
residuarios
uses the
sanitarios o
10,000
tampones
to
a lo largo de
13,000
toda su vida
pads
reproductiva,
or
esto
tampons
equivale
throughout
a que
all
más o
their
menos cada
reproductive
mujer
life, this equals
produce
that each woman
65
produces
kilos de
65
basura
kilograms
a
of
lo largo
garbage
de
throughout
su vida. Si
their lives.
multiplicamos esto a
If we
nivel
multiply
global por
this
todas las
at
mujeres que
the
están menstruando,
global level
la
or by all
cantidad
the women menstruating, we can
de
see the
productos que no son
amount of
biodegradables y que
products
se
that are
demoran
not
entre
being
500 y
that are not
800 años
biodegradable because they
en
take 500 to
desaparecer,
800
¿no?
years to really
de la faz de la
disappear
tierra.
from the
Muchos de
earth.
estos productos
Many of
terminan
these
en los
products end
océanos, en los
up in the
vertederos, en los
oceans,
ríos y
in
nos vemos
landfills, in rivers,
que esto es,
and we see
está
that
generando
these
a
might be
ya un
generating
problema con el medio ambiente.
already a problem with the environment.
Contamos con
We
productos
also
alternativos
have
reutilizables,
alternative
pero
products that
esto
are
todavía
reusable,
sigue
not
siendo muy
disposable,
poco
but
utilizado y
these
solamente
products are not
el
very much used really,
14% a
and
nivel
only
mundial usa
14%
estos productos.
of women worldwide use these products, these
Sin embargo, no
reusable
todos
products.
son malas
However,
noticias. Tenemos
not
otra cosa
everything
más.
is bad. Not all are bad news.
En
We
las
also
áreas
have
de
some
abogacía y
progress that has been
política,
made.
en
In
el
the
año
areas of advocacy and
2014,
policies in
cuando no se
2014,
logró
when
que,
we didn't
digamos, haya un indicador de los ODS
didn't manage to
en los
create an indicator of
relacionados a la
the
salud
SDGs
menstrual,
related to
se
menstrual health.
decidió
However, we didn't achieve this, but
hacer la
we
promoción necesaria a
decided
través de
to
la
make
designación
some
mundial de la
advocacy
higiene menstrual.
through the
¿Cuándo es
creation
ese
of
día?
a
El
menstrual
28 de
hygiene
mayo. ¿Y
day,
por qué se
World
consideró
Day.
el 28 de mayo?
Why this day is May
Porque el
28th? And
28
why May
son más
28th?
o
Why?
menos
Well,
los
because
días que dura el
28,
ciclo
this
menstrual.
is more
Y
or less the
5
days that the
son
menstrual
los días
cycle
que dura más o
lasts, and
menos
5
la
are the
menstruación.
days
Entonces,
that
por
the
esto, el
menstruation,
28 de mayo
actual menstruation
es
lasts.
el
That's
Día
why
Mundial de la
May
Higiene
28th
Menstrual.
is the World Day of
A lo largo del
menstrual hygiene.
mundo se han
Throughout the
desarrollado una
world,
serie de
there
políticas
have
y leyes
been a
nacionales
series
a
of
favor de la salud
policies
menstrual,
and
porque nosotros
national laws
sabemos
passed in favor of menstrual
que
health
si no
because we
hay una
know
norma,
that
una
if there's
ley,
no
es bien
standard, there's
difícil
no
que
law or
podamos
regulation, it is
implementar
pretty
medidas
difficult that
para
we would be able
solucionar
to
un problema
implement
de
measures to
salud
solve a
pública.
problem,
En
a
Etiopía,
public
por
health
ejemplo,
problem. In
la
Ethiopia,
norma
for
salió a
example,
través del Ministerio de
the
Salud.
standard
En
was
Zambia
published
fue
by
a
the
través del
Ministry of Health. In
Ministerio de
Zambia, it was done
Educación.
through the
En
Ministry
la
of
India,
Education.
las
In
normas salieron
India,
a través
these
de los
regulations
ministerios de
were
agua y
promoted by the
saneamiento, ¿no?
ministries of
En
water and
Sudáfrica, por
sanitation. In
ejemplo,
South
fue el
Africa,
departamento,
it was
el Ministerio
the
de la Mujer el que
Department of
promovió
Women or the Ministry of Women that
una
promoted
norma para resolver el
a
problema.
standard or a
Contamos, por
regulation to
ejemplo,
deal
con
with this
normas
problem.
en
We also
Chile,
have
¿no? La guía de salud
standards in
menstrual que
Chile,
está
the menstrual
promoviendo el
health
Ministerio de Salud.
guideline promoted by the
En
Ministry of
Colombia
Health. In
también y
Colombia, we also have something, and
en Etiopía.
in Ethiopia,
Digamos, tenemos diferentes
well,
ejemplos
we
de
have
países
different
que están
examples
ya
of
implementando
countries that are
leyes y
already
normas ad
implementing
hoc para
laws
atender
and
este
standards
problema.
that are adequate and
Otro
ad
logro
hoc
que se
to
ha
take care of this problem. Another
alcanzado a
achievement that
través de
we have
la
had
abogacía y las
through
políticas es
advocacy and policies
el
is
acceder a la licencia
being
médica, es
able
decir,
to access to
saltar,
medical leave, that
si
it's to
fuese
be able to,
necesario,
if it's
cuando
necessary, of
tenemos
course,
algún
to be
trastorno
able
o una
to
molestia asociada a
have
la
a
menstruación.
leave from our
Japón,
work
por
if we
ejemplo,
have a
tiene
condition
la
associated to
licencia
menstruation.
médica
Japan, for
para la
example, has a
menstruación
medical leave
desde
for menstruation
1947,
since
pero sin embargo
1947.
es
However,
muy poco
it
el
is
uso que hacen las
very
mujeres
women
de
use
este
it very,
derecho
very
porque
little. We they
es un
use it
día que no se
right
paga.
very, very little because that's
Posteriormente,
a
hay
day that
diferentes
they don't go,
países como Corea,
cannot go to work,
Indonesia,
but it's not paid
España,
either. And we
Francia,
have other
Colombia
countries
y
like
algunos
Indonesia,
estados de
Spain,
México que han
France, Colombia, and
implementado
some
diferentes
states of Mexico that
modalidades
have implemented
para
different
lograr la
modalities
licencia médica.
to achieve the medical leave.
Algunas empresas como Nike
Some companies
también
like
está
Nike,
implementando la
they are also
posibilidad de licencia
implementing the
médica
possibility of
los
having
días
a
de la
medical
menstruación,
leave
1 o 2
during
días antes,
the
aquellas
menstruation days,
mujeres que lo
1 or 2
piden.
days a month for those women that
El
require
gran
this, of
avance
course.
que ha habido,
The
sin
great progress
embargo,
that
ha
has been
sido
done,
para
however,
tratar de
has
reducir
been
el
the
costo de los
progress made in trying
productos
to
de higiene
reduce the
menstrual.
cost of the menstrual hygiene
Y esto, la
products.
primera
And this,
estrategia fue de
well, the
tratar
first
de
strategy
disminuir los
was to try
impuestos,
to decrease the
lo que
taxes
es el
that
impuesto
these
general a
products
las
pay,
ventas,
the
nosotros
sales
lo
or
conocemos aquí como
tax or
el
the
IGB,
VAT
vemos que el primer
tax.
país que
And
redujo
can see that
este
the first
impuesto fue
country
Kenia
that
en
reduced this
2014. Después,
tax was
diferentes
Kenya in
países,
2014.
Canadá,
Then
Reino
different countries
Unido,
like Canada, the
África,
United
Nigeria,
Kingdom,
Asia, la India,
African countries,
se han unido
Nigeria, India, they all have joined
a esta medida.
this, this measure.
En
They have
América Latina,
taken this measure
el
and adapted
primer
it.
país que
Adopted it. In Latin
redujo
America,
el
the
IVA
first
fue
country
Colombia
that
en el
reduced the
2018 y luego
VAT was
México y
Colombia in
luego han
2018,
seguido
then
otros
Mexico,
varios
and then
países
some other countries
en
have
la
followed
región. En Estados
in the
Unidos,
region. In
solo
the
algunos
United States,
estados han
only some states
reducido
have reduced
el impuesto, no
the
todos.
taxes,
En
not all of them.
Argentina, por
In
ejemplo, ya
Argentina, for
nuestra
example,
colega
our
en el panel
colleague
nos contará más detalles,
from the panel will give us more
se
details.
estableció en algunos estados la recuperación
But
de
in
este
some
impuesto.
states, they
Desde inicio se redujo el impuesto,
established the
pero sí
recovery of
dio
this
la
tax,
posibilidad que
the reimbursement of this tax. That is, they
en algunas
continue paying taxes,
situaciones
but in some situations
de pobreza
of
pobreza
poverty
o en situación de
or
vulnerabilidad
vulnerable
podía
population,
recuperar
these populations
este
can
impuesto.
get a
Sin
reimbursement
embargo,
for this
solamente
tax.
9 de los 31
However, only
países de
9 of
América
the
Latina han
31 countries
logrado
in
esta
Latin
reducción.
America have
Y
achieved
cuando
this
nosotros
reduction. And when
consideramos que
we
estos
consider
productos
that
sean
these
como de primera
products
necesidad, es
are
el primer paso
products
para lograr
very
que
important first need
estos
products, this is the first
impuestos
step
sean
to really
se
achieve
pueda reducir los
a
impuestos que
reduction
gravan estos, los productos de la
in this
educación menstrual.
tax.
Sin embargo, en
However,
contraposición vamos a encontrar
we will
que
find also
algunos
that
países
some
han
countries
considerado
have considered,
como tienen un impuesto como si fuesen artículos de
I
lujo,
mean,
por
they have
ejemplo en Suiza
they tax these
o en
products as if they
algunos
were
estados de Estados
luxury
Unidos,
items,
tienen
like
un
in
impuesto que es
Switzerland
aún
or in
mayor que
some state in the United States. These
los
menstrual
productos minerales
hygiene
porque los
products
tampones,
have
por
a
ejemplo,
tax
son
that are higher than other
considerados
products because tampons, for
como
example,
productos
are
de lujo. Y
considered
estos,
as
como
luxury
todas
products.
sabemos, no
And
son
as we all know,
absolutamente, no son
these
productos
are
de
not
primera
luxury
necesidad.
products. These are
También se ha
really
avanzado en lograr la
first need
gratuidad,
products. There
¿no?
has been some progress in
Escocia,
achieving
en
the
el año
um,
2020, fue
making
el
these
primer
products free.
país en lograr la
Scotland was the first
gratuidad para
country in
toda la población.
2020 to
Uno puede
achieve being able
encontrar
to
en
provide this
Escocia
product for free in
productos a
all
los
the
que se
population.
usan
In Scotland, you
tampones,
can
toallas
find menstrual
higiénicas,
hygiene
en todos
products,
lados, en los baños
pads,
públicos, y esto
tampons
se han
everywhere in
asegurado que
public
todas las escuelas, es decir, que
restrooms, and
haya
they have
toda
made
la
sure that all the
población
schools,
acceso.
that
En
everybody
la
has
India,
access to them.
Kenia, Sudáfrica y New
In
York, por
India,
ejemplo,
Kenya, South
se ha
Africa, New
priorizado la
York,
distribución free de
they
colegios.
have
En
prioritized
México y en
free
algunos
distribution in
estados
schools. In
se
Mexico,
entrega
it
en
is in some
forma
states
de
that they
colegios
provide
públicos y
these
mujeres
products
privadas de la
for free
libertad.
in
En
public
Colombia y Nueva
schools,
York, por ejemplo,
and
se
women
entrega a
deprived of
mujeres de
their
calle y
liberty.
a
In
mujeres privadas de su
Colombia,
libertad. En Brasil,
it's
por
also
ejemplo,
even in
existe el
some places in the
programa
street and
de
in the prisons in Brazil. There is a program also.
menstruación digna,
It's called dignified menstruation,
que distribuye
and it is a
gratuitamente
program
estos
that
productos
distributes for free
a
these
mujeres en
products to
pobreza extrema,
women in
a
poverty and
colegios
extreme
públicos y mujeres
poverty,
de
to
calle.
public
El
schools,
problema
and
es que es
women
un
living in the streets. The
programa un
problem
poco
is that this is
burocrático, uno se
kind of
tiene
a
que inscribir,
bureaucratic
en fin,
program. You have
requiere
to
todo un trámite
register.
y esto está
It's
haciendo
a
que,
whole thing to
digamos,
be able
el
to be a
acceso no
beneficiary
sea
of this
para
program,
todas las
which
mujeres, sino todavía aún restringido.
doesn't
Perú
allow
tiene una
it
ley
to give access to
que
all women, but it's
ha
very restricted.
priorizado a las
Peru has
mujeres en
a law that
situación de
has
vulnerabilidad,
prioritized
pobreza, pobreza extrema, pero la
women
ley
in
todavía
situation
no
of
se ha
vulnerability,
implementado.
poverty,
Y en
or extreme
Argentina, bueno,
poverty, but a
tenemos
law has not
algunos
been implemented yet. And in Argentina, we have some
gobiernos de algunos estados o distritos
states or
que han
districts
priorizado
that have
algunos grupos como de
prioritized
pobreza, pobreza,
some
etcétera, y
groups
uno se
like groups
puede.
of
Y
in
lo
poverty or
interesante
extreme
también ha
poverty
sido que en
and schools.
todo
And
se ha
what it's
incluido
been
en los paquetes
interesting
de
is that
respuesta
in
a
all of
conflictos que
them, in
son
the
en crisis
uh,
humanitarias, también se han
in
incluido
all
los
the
productos de la educación
packages for
menstrual como
response
parte
to
del
humanitarian
apoyo a
crises,
esta
they have
población.
also included menstrual products as part of the support provided to
¿Cuáles
these
son las
populations.
experiencias
What
que
are the
tenemos en la
experiences
atención de
that
la
we
salud
have in
menstrual,
terms of
¿no?
the care of menstrual
Mejorando los
health?
aspectos de infraestructura,
Well, improving the
con baños que tienen acceso a agua,
infrastructure
desagüe y
of
productos de gestión menstrual.
toilets,
Y
providing
en
access to
Brasil y en la
water,
India, por
sewage, and
ejemplo, se
menstrual hygiene
proveó de
products. And in
productos
Brasilia
anticonceptivos, se
and
mejoraron
India,
las
for
condiciones
example,
de los
they
baños
improved the
y esto
conditions of the toilets and
mejoró las
provided
tasas
menstrual
de
hygiene
abandono en el
products, and
colegio.
this
En Ghana también
improved the
un
dropout rates in
proyecto
schools.
donde
In
se
Ghana, there
entregó
was
en forma
also a
gratuita
product
toallas
in which
higiénicas
they
y detergentes
delivered
menstruales y además se
reusable
brindó
menstrual pads to
educación
women, and they
A los
provided
6 meses
education
ya
in
hubo un cambio
menstrual health.
en la
And after 6 months
asistencia
of starting the
en
program, they
Venezuela,
started
mejorando
seeing
sustancialmente.
a change in
La
the
distribución
attendance,
gratuita de
improvement in the
toallas
attendance to
higiénicas
school of these girls, the free distribution of menstrual
como
pads
parte de la salud
as
menstrual
part of
reduce
menstrual health
significativamente
reduces
también la incidencia
significantly
de
as well
infecciones de
the
transmisión
incidence of
sexual
sexually
y
transmitted
vaginosis
infections
bacteriana.
and
Esto ha sido mencionado ya
bacterial
en algunos
vaginosis.
estudios.
This has been shown already in some studies.
El impacto que tiene, por
Tanto,
ejemplo,
doctora
también,
Subiría, por favor.
Dr.
¿sí?
Subiria,
Tenemos poco tiempo ya, por favor.
we
Bueno,
are
entonces,
running out of
bueno,
time.
vemos que
Okay, we can see that
hay intervenciones también en
there
educación,
are also
¿no?
interventions
Quisiera
in
presentarles
education. I would like
algunas
to
herramientas que tenemos
show
para
now
esta
some
intervención
tools that
acá,
we
que
have,
es
like this one here that
el,
you can see in
digamos,
the
esta es una
screen.
herramienta a la cual
This
todos
is a
ustedes van a
tool
tener
that you
acceso y
all
le
will
va
have
a poder
access
dar
to, and
información
it will
para los que son
provide
tomadores
you
de
information,
decisión.
especially for
Esta
those of you who
herramienta
are
a la cual ustedes
decision
pueden
making.
acceder les va a dar
For this
información
tool,
con
this will
respecto a
give
qué productos están usando en su
information
país,
regarding what products
¿no?
are being
Cuáles
used
son
in
los
your
costos
country, which are the
de estos
costs
productos si hago una
um,
proyección
of these products,
a
and
largo plazo. Si
and
puedo,
if you want to make a projection in the
si
long
cambia,
term.
por ejemplo, si ya no uso
For
productos
example, if I do not
descartables
use
y
any longer
reutilizables, ¿qué
uh,
impacto tienen en mi
disposable
presupuesto? Son
products, and I
los
start
alcances que
using
pueden
reusable
conseguir con
products,
esta
the impacts
herramienta.
that I would have with
Un
this.
avance también
This is
importante es
what
en la
this
creación
tool
de
helps you
estándares.
to
No
do.
tenemos
There's also something
estándares
important
que
about the creation of
aseguren,
standards. We do not have
que los
standards
productos
that
que estamos utilizando son
ensure that the
saludables. Si
products
ustedes
that
se
we are
fijan
using are
que
healthy.
lo que
If you
dice, por
see
ejemplo, un paquete de toallas higiénicas
what
solamente
a,
dice uso
sanitary pads
flujo
package
regular,
says, it
medio,
just
bajo,
says
pero no
mention
tenemos
flow,
que son,
regular,
por ejemplo,
medium, or low, but we do
bioseguros,
not
que tienen un
have
pH
any
adecuado, una
information
fuerza
on
a la
whether they
piel,
are
¿no?
biosecure, if they have an
Uganda en
adequate pH, if
2017
they do
fue
not
primera
damage
en
skin. Uganda
estandarizar
in 2017 was
copas
the first country in
recipientes
standardizing
reutilizables. Vemos
reusable
que, por ejemplo, frente
sanitary
a
pads.
un
We see that,
mismo
for example,
dispositivo, diferentes
vis-a-vis
categorías en los diferentes países. En
one
Estados
same
Unidos, en Nueva
product has
York,
different
en
categories
noticias
in different
recientes
countries. In the US, in New
se
York, in
anunció que era
2019, they
necesario
established
que
for the
las
first
toallas
time
higiénicas
in
tengan
2019 that it was
impreso
necessary
en el
for
exterior
sanitary
todos
pads
los
had
componentes
printed in the
de
package
los
all the
cuales están
components
conformados. ¿Por qué esto es
that it
importante?
is made of.
Porque hay
Why it is
productos
important?
que
Because
se
there are
están
products
utilizando
that are being
para
used
limpieza, para blanquear,
for
para darle olor y que pueden estar
cleaning, for
poniendo en riesgo
making
nuestra
the
salud
product very white,
por
or
el
to
contacto que
put
tienen con
some
nuestra
scent
piel.
on it,
Esto
and that
todavía no
it
está
might not
normado del
be
todo.
healthy for us.
¿Cuáles
No,
son
and
los
this
desafíos?
hasn't been
Bueno,
regulated yet. And what are the
tenemos
challenges?
desafíos sobre
Well,
todo
we
en
have
saber qué es lo que
challenges,
está pasando y
especially in
para esto
knowing
es
what is happening. And
necesario
for
el
this,
monitoreo.
it is necessary to have
Ha
some
habido un
monitoring. There
convenio,
has been an
un
agreement,
acuerdo global entre
a global
diferentes
agreement
instancias, agencias,
among
ministerios,
different
la OMS,
instances,
en establecer
ministries,
4
the
indicadores de
WHO, to
seguimiento.
establish four
Unos están
tracking
relacionados
indicators.
al uso
One,
de los
some
productos
of them are
sanitarios
related to
menstruales
the
en el
use
último
of
periodo como un
uh,
indicador que se
menstrual
cuenta con
hygiene
un espacio
products in the
privado en
last
casa para cambiar
period,
los
that
productos y
whether
que
there is
cuentan
a
con los
private space at
conocimientos
home to
y
change the
que,
products, that
digamos, la
whether there is
menstruación
knowledge.
no
And the
me
fourth one
impide
is
asistir a
that
mis actividades
menstruation
diarias,
doesn't prevent me
¿no?
from
Tenemos
doing my
este
day-to-day
documento en donde
activities.
ustedes
We
también
have
van
this
a poder
document that
acceder
you will be able to
y en
access
este
it as
documento
well.
ustedes van a
And in this
encontrar
document, you will
las
find actually
herramientas
the
de los
tools
indicadores para poder medir cada
of the
uno de
indicators
estos
to be able to measure each one of
indicadores, una
these
ficha que describe
indicators. This is
cómo estos
a
indicadores
card
pueden
that
ser
describes how
incluidos
these indicators
ya
can be
de una manera
included
muy detallada
in a
en las
very
encuestas de
detailed manner
demografía y salud, que
in
es uno
the
de los ejes que se
demographics
desarrollan
and
en
health
los países.
schools, for example, this kind of
Ya se
surveys
están
that are done in each one
reportando,
of the products.
ustedes ven
Um,
que algunos
we
países
have
están
already been,
reportando
you can see that some
cómo
countries
van
are
en
already
uno,
reporting
dos, tres
how
o
they
en
are doing
cuatro
in one, two,
indicadores.
three, or the
En
four
América
indicators.
Latina,
In Latin
lamentablemente,
America,
solamente contamos con
unfortunately, we
información
only have
de
information of
algunos países como son
some
Cuba, Costa
countries like
Rica,
Cuba,
Nicaragua,
Costa Rica,
Honduras y
Nicaragua,
Guyana.
Honduras, and
Todavía
Guyana.
tenemos que hacer
Um,
bastantes avances en
we still
poder
have to
monitorear cómo van los
make a great
indicadores en
deal of
nuestros
progress to
países.
implement how the implementation of these things is going in each one of our countries.
Muy bien, ya me
Very well then.
Esto es para que ustedes vean
This is for you
el
to see
monitoreo de los 4
the
indicadores.
monitoring of the four
El más
indicators. The
fácil
most,
de monitorear
the
es el
easiest
uso o
one
no
to
de los
monitor
materiales
is the use
adecuados.
or not
Luego
use
si
of
vemos el
adequate
paño húmedo,
materials.
si por
Then
ejemplo
the
contamos con
toilets,
información
for
que
example, if we
menos
have
riesgo sea un
information
impedimento
and
en que yo pueda realizar mis actividades
if
cotidianas
I
de
have
higienización, son
some
los indicadores menos
problem that
reportados.
do not allows me
planteando
to
modificaciones
conduct
en
my
estos
activities.
indicadores. En el primer indicador
We are
se está
proposing
tratando no
modifications in
solamente
these
que haya
indicators. In the
resultados
first
del
indicator,
uso de productos de
they
gestación
need
menstrual
not
y que
only
tengamos
to report
suficientes
the use of
para
the
todo el
product in the last
periodo, y se
menstrual
están
cycle, but that they
incorporando dos
had
indicadores
sufficient
más.
products for all
Hoy
the
tengo
period,
la
and they are
posibilidad
incorporating
de
the two
verme
new
cuando presento mi
indicators.
emergencia
If
y
I have
sí
the
cuento
possibility
con
of going
apoyo, es
to
decir, tengo un ambiente
get medical health, if
alrededor
I
que me
have some
pueda
discomfort or problem, and if I have support, is the
ayudar
other
cuando
indicator.
presento algún
If I
tipo de
someone that can
trastorno
help
menstrual.
me, if I have some type of
Finalmente,
menstrual
¿cómo estamos
condition or
atendiendo el medio
problem.
ambiente?
Finally, how are we
Todavía
dealing with the
no lo
environment?
estamos
Well,
haciendo,
we
pero
are
lo que
not doing this
necesitamos hacer es
yet, but what we
justamente
need to do is
difundir
actually to
el mayor
disseminate
uso de estos medios,
uh,
métodos o
they need to
productos de gestión
use
menstrual que son
these
reutilizables,
products that are
justamente para
reusable
disminuir
in
el
order
impacto
actually to
que puede
decrease the
tener en el
impact
medio
that
ambiente y buscar nuevas
this might have
alternativas.
in the
Se
environment
han
and look
hecho
for new
algunas
alternatives.
experiencias con el uso de
There are
bambú
some
y fibras de
experiences that
plátano
we have
rojo
had with the use of bamboo
al interior de
and
las toallas
plantain
higiénicas. Es un nuevo producto
sheets to
que
put that inside the
mejora la prevención
sanitary
de
pads. And there is a new product also
absorción,
that improves the
evitar
absorption
que
conditions
haya derrames,
to
no
prevent
puede ser
overflows
añadido
and to
tanto
that
en
can be
las
added
toallas
both in
sanitarias como
the
en la copa, de tal manera que
cup and in the
sea
sanitary pads in
y
such a
también
way that,
estas
and also, well, it
no
is
genera
also,
el
it doesn't
crecimiento de
generate
patógenos.
the growth of pathogens,
Estaríamos
and
esperando un
we would
poco que
be,
estas nuevas tecnologías
well, waiting.
avancen.
We hope that these
Finalmente,
new technologies can
quisiera
continue
decir
making
que la
progress.
atención a la
Finally, I
salud
would like to
menstrual
say
no
that the care of
solamente es un
menstrual health
tema de
is
mujeres,
not only
sino es un tema de
something
todos
related to
nosotros.
women, but
Muchas
it's something
gracias.
related to everybody. Thank you very much.
Muchísimas gracias, doctora
Thank you very
Subiría, por su
much, Dr.
interesante disertación. Realmente
Subiria,
nos
for your
permitió
interesting
ver el
presentation. It
fenómeno
has really
rápido
allowed
y
us
todo
to see the
la
work done in
importancia
menstrual
de
health,
incluirlo en las
and
políticas y
especially the
normativas
importance
relacionadas con
of
este tema.
including these
Esto es
in the
fundamental para
policies
lograr
and
tener una
regulations of the
salud
country. This is fundamental to
reproductiva,
achieve a more
pero es
just and or
exclusivo
fair and
para generar
equitative
equidad de género
uh,
y para, se
health
hace
health
necesario
system,
trabajar
and
en
also for
políticas públicas
gender
y
equity. So we need
conjugar un
to work
compromiso de los
in an
diversos sectores
intersectorial manner with a
interesados
clear
sociales,
commitment of the
así
different
como
sectors,
también para
especially the
proteger
education
la
sector,
salud
and also to
laboral y
protect the
social
health
que viven
and
muchas
with the
niñas,
discrimination that many
adolescentes,
children,
mujeres
girls and
desarrollando
adolescents and women
profesionales
experience.
de la salud
And for that, it is
profesionales de
important that
educación y de
health
otras áreas
professionals,
consideren al
the
ciclo
education
menstrual
professionals
como
and
algo
other
como un
areas
indicador no
consider
solo
the menstrual cycle
para
as an
salud,
indicator, not
sino
only for health,
también para el
but
desarrollo
also
de las
for
niñas
the
y las
development
adolescentes.
of children,
Nuevamente, muchísimas
girls, and
gracias por su
adolescents. Again, thank
disertación.
you very much for
Pedimos
your
que mantenga
presentation.
para el ciclo
We
de
will request
preguntas.
you to
A continuación,
stay with us for the
tenemos
Q&A session at
a
the end of the
Viridiana Zamora.
day. Now we
Viridiana
will have
se
Viridiana
especializa en
Zamora. Viridiana
programación
is civil
nacional autónoma
engineer
de
by
México
the
y cuenta con estudios de
University of
maestría en
Mexico, and she
administración
has
financiera,
master's
organismos
degree studies
administrativos.
in
Su experiencia se ha
financial
enfocado en el
optimization. Her
desarrollo e
experience
implementación de
is based
programas
on the
de agua
development and
potable en el
implementation
gobierno
of water
mexicano,
sanitation
acumulando
hygiene
cerca de 2
programs in
meses de
Mexico
trabajo
with
continuo dentro
around
del
12
sector,
years of continuous work
colaborando
in
con
the sector,
organismos como el Banco
collaborating with
Interamericano de
entities like
Desarrollo
the
y
Inter-American
Organización
Bank of
Mundial
Development,
Gubernamental World
the
Vision.
World Vision
Actualmente se
NGO.
desempeña como oficial
Currently,
nacional de
she
agua
is a
potable,
national
higiene y limpieza
official of
en
water
México,
sanitation
en
WASH in
donde
UNICEF Mexico,
brinda
where
asistencia
she
técnica para el
provides
diseño,
technical assistance
implementación
for the
y
design,
sostenibilidad de
implementation,
programas.
and
La
sustainability of
provisión
programs
de
for the
servicios de WASH
provision
en las
of WASH
escuelas y
services in
ante
schools
emergencias humanitarias,
and
atendiendo
before
aspectos
humanitarian
gubernamentales y
emergencies,
generando
taking into
alianzas
account
con el gobierno del
governance
sector
aspects and
privado
generating
y escuelas
alliances with the
militares.
government, private
Bienvenida,
sector, and civil
Viridiana, por
society.
favor,
Viridiana, you
tiene
have the floor.
la palabra.
Muchas gracias, Gloria, y muchas gracias también
Thank you very
a
much,
Horas
Gloria, and
ONU
thank
por
you
el
very much to
espacio
Horas Konu
brindado
for this
y
space.
también pues muchas gracias
And thank you
por
very much as well
este
for
marco
this
tan profundo que nos brindó sobre el tema de salud
previous
menstrual.
presentation that we have
Pues
had
voy a
on
compartir mi
menstrual health.
pantalla.
I'm going to share my screen.
Si me confirman, por favor, que pueden verla.
Viridiana, por favor, le pediría ajustar su tiempo porque también
Viridiana, I would
Inés tiene
request
un
you
problemita
to
con la
stick
hora.
to your
Sí,
time
claro,
because we're having
voy a ser lo más breve
we're kind
posible.
of delayed. Yes, I'm going to be as
Bueno,
brief as I can, of course. Well,
como ya mencionaba
as
Gracia,
Gracia already mentioned, the topic of menstrual health is really very extensive, and it is cross-sectional to different sectors. So I would like to kind of go to some of the things that he has mentioned with this reflection. We know that menstrual experiences are an important part of the phenomenon of reduction of opportunities, discrimination, and gender violence that currently impacts girls, adolescents, and women, and menstruating people. So having a menstrual ovulation cycle does not involve by itself a natural disadvantage, but the social, political, economic, environmental, and cultural contexts or settings in which this population live might lead to having the fact that the menstruating impacts negatively their quality of life. Therefore, it is important and necessary to have a comprehensive approach of menstrual health to deal with all these limitations, menstrual poverty, the limitations of opportunities and autonomy, violence, stigma, taboo, and the gender gaps that are affecting to actually guarantee that girls, adolescents, menstruating people to be able to develop their potential at the maximum level, both at the professional and personal level. We had kind of we have already seen how the menstrual health is approached in the um, Agenda 2030, and I'm just going to mention that menstruation is an issue of rights, something that needs to be approached from the different dimensions that are adequate: physical, psychological, social, and also guarantee access to at least these four spheres. Menstrual education should be free of taboo. It should have a scientific base, and it should allow as well to, well, should allow access not only for people that menstruate, but also for children, men that are also live with children, women, or girls that menstruate, guarantee access to management products that are adequate to the context, the uses, and the environments in which these girls and women live, the provision of infrastructure, adequate infrastructure as well. And we have already seen these services of water, sanitation, and hygiene, and health services that, apart from being of quality, are empathetical, and that actually are adequate for the needs of the population, and the full participation of girls, women, people menstruating to guarantee that they are listened to and their needs are taken care of as adequate. And finally, all these aspects should be included in the work plans and the budgets of the government, and this should be constantly reviewed to consider improvements and to be always taking care of the needs that might arise. Specifically, in Mexico, what have we done? On the one hand, in 2021, there were different reforms to the general law of education approved, which was known as law of dignified menstruation, seeking one to guarantee access to menstrual education as I have mentioned, free of taboos with a scientific basis, and on the other hand, free access to menstrual hygiene management products in all public schools. This is a program and a draft or law or that bill that has been approved in different states, and currently there are two states that already are working in an active manner with specific budgets and programs to approach these two spheres in schools at these states are Jalisco and Michoacan. Since January 2022 as well, we managed to eliminate the VAT of 16% to the menstrual management products, with which we have had a very important impact, particularly in the most vulnerable population and in girls, women, and people menstruating of the lowest resources. We have also advocated in the agenda on the menstrual medical leaves. Gracia mentioned this, so that women can make this decision maybe of not going to work when their menstruation related symptoms do not allow them to work well in their place of work, and also in the creation of red points. That's how we know it. These are places where they have access to menstrual hygiene management products for free. And finally, this program is also implemented in the prisons. This was based on a recommendation of the National Commission of Human Rights. And based on this recommendation, we are already working and we are training the security staff and the administrative staff of these prisons for them to have a better understanding of menstrual and ovulatory cycles and to provide better information, have more empathy, and manage in a better manner menstruation with women deprived of their liberty. Here, in a more graphical way, you can see the progress made in terms of the law of dignified menstruation. 16 states, which is around 50%, they have legislation already in terms of this law. They have some regulations, and 11 of these states already guarantee products for free. And as I said, Jalisco and Michoacan are the uh, states that already have comprehensive programs around education and access to menstrual management products. Specifically in UNICEF Mexico, what are we doing? Well, we are approaching the menstrual health problem from two contexts. On the one side, schools, through our program of our WASH program in schools, and through humanitarian crisis focus on population in mobility through our Watching Emergencies program, and considering this relevance that this has and the problems that we have around migration in the region of Latin America. Why do we link menstrual health with the WASH sector? Well, we know of the importance of access to services, as we had already seen with Gracia, but we know that through the improvement of knowledge, attitudes, and practice related to these services, and added to menstrual health, we can potentiate these social and health impacts to have some impact, positive impact in school communities. And through this, we might have more effective approaches of watching schools that will consider and have this gender perspective, actually, to consider the menstrual health aspect, and that these services are more and more friendly and more ad hoc, so to say, to what children, girls, or women that menstruate need. And we do this in an informed manner with surveys, with KP studies, and through these tools we have found, for example, that 43% of children girls in Mexico do not go to school during their menstruation, with the impact that this has with absenteeism and, lack of knowledge and a likely abandonment or drop off from school later on. And only 16% of girls had clear knowledge on menstruation before they started menstruating, and this percentage decreases extensively in the case of boys. Only 5% of boys knew what menstruation was, in a clear manner, of course. Specific action, well, first of all, in 2021, we had a first national survey on menstrual management, which was applied to a population between 12 and 70 years of age, to know how they live or lived or manage their menstruation, and the impact this has had in the spheres of their lives. And in infrastructure, we found that 20% do not have the necessary infrastructure in schools or in their jobs, and 56% do not have access to inputs for free in these spaces. In health terms, even though 68% mention having some discomfort or important symptoms during menstruation, only 4 out of 100 people go to look for medical care, which indicates on one side the lack of access to services, and on the other side, health services, of course, and on the other side, it shows the lack of knowledge and the normalization of living with the symptoms as normal part of our day-to-day for the mere fact of menstruating. In terms of economy, 55% of people had to decide not to buy foods services or
y el
medications to buy
85%
the sanitary
desconocía que
pads, and
hasta el
95%
2022
didn't know that up
pagaba
to
IVA sobre
2022,
estos
these products were
materiales de
paying
higiene menstrual.
VAT.
Por otra parte, hemos desarrollado
On the
herramientas
other
educativas.
hand, we have also
Tenemos
developed
los manuales
educational
sobre salud
materials. We
menstrual.
have some
Estos los acabamos de
manuals
publicar
on menstrual
ahorita en
health,
mayo de
menstrual
este
health that
año.
have
Ya
just
tenemos
been
una
published
versión
in May
beta,
this
sin
year.
embargo, esta
We had
versión
a
nueva
previous version, but this new
tiene
version
un
actually has
enfoque de
a
derechos y de
rights
derechos y de género mucho
approach
más
and gender
fortalecido y
approach that
también
it's
con una
much more
estructura
stronger,
que permite pues
and a structure that
una mayor
allows
aplicación
for
dentro de
a
las
better
escuelas.
application in
Contamos con una
schools.
versión para
We have
personas
a version for
facilitadoras y otra versión para
facilitators and
niños,
another
niñas
version
y
for children
adolescentes.
and
También
adolescents.
desarrollamos una
We
aplicación que
also
se llama
developed an
Oki México.
application
Esta
which is called
aplicación
Oki
les
Mexico.
permite a las niñas
This
y a los
application allows
adolescentes
girls and
rastrear su periodo y
adolescents
también
to
acceder a la
track
información
back their
de
period and
manera
access
lúdica.
to information in
Ahora
a
mismo
playful
tenemos
manner.
esta
Now,
aplicación
actually, we have this
definida y
application
estamos en espera de
well,
financiamiento
we are
para
not
poder
using it
reactivarla.
at this
Sin
point. We have
embargo, es
stopped
una
it and we are
aplicación
waiting for
pues
funding to reactivate it. But this
bastante
is an application that it's very
divertida, o sea, es muy fácil de
it's pretty
utilizar.
fun,
Lo
really. It's
más
very easy
importante
to
es que
use.
fue
And the most
co-creada
important
por y
thing
para
is
niños.
that it was
Entonces,
co-created for and
está
by
muy,
children, girls, actually.
como
So it is like
adecuada
very
para
adequate
justamente niños
to
y adolescentes
actually
entre
for
12
children
meses
and
de edad.
adolescents 12,
Y finalmente, con
12 to
base en
19
estos
years of age.
manuales,
And
estamos
basically, based
desarrollando
on our
un
manuals, we are
curso
developing
masivo en
a
línea, el
mass
cual
online
próximamente
course,
estará disponible.
which
Estimamos
will
que
be
estará
available
disponible
soon.
a
We
principios
estimate that it will
de
be available
2025.
at the
Estamos
beginning of
trabajando en conjunto con la
2025, and we
Secretaría
are
de
working
Educación
together
Pública
with the
para
Secretariat of Public
que este
Education
curso
so
forme
that
parte
this course
de la
will become
oferta de
part
formación
of
continua de
the
docentes y
continuous
directivos. Entonces
education
esperamos que tenga un
um,
alcance nacional.
plans for
En términos de
teachers
incidencia y
and
asistencia técnica, pues
principals of
desarrollamos
schools. So we
constantemente
hope that
foros para
we will have
presentar
a
resultados
national
de
scope.
la
And in terms of
encuesta, de los
advocacy and
estudios
technical
que
assistance,
lanzamos.
we are
También
also
fortalecemos las
sharing the results of
capacidades de
our surveys,
autoridades
the studies that we
educativas,
do. We also
de
build the
promotores de
capacities of
difusión, de
educational
personal
and
eh,
authorities.
a nivel
We work with
global
the
del sector de educación
decision-making staff
en
in
torno
the
al
education
tema de salud
sector.
menstrual y
We
apoyamos algunos
talk to them
estados
about
en
menstrual
esta
health, and
parte
we support some
de la
states in this
legislación,
part
¿no?
of the
En términos de
legislation
la
as well,
aprobación de la
in
ley
terms of the
menstrual digna.
approval of the law of
Pasando un poco
dignified
al tema de
menstruation.
crisis
Now getting
humanitarias,
into
pues sabemos
humanitarian
que de
crisis,
por sí
well,
el
we
tema de
know
salud menstrual ya
that
tiene
menstrual
retos
health by
importantes
itself has
para
important
niñas, mujeres y
challenges for
personas que menstruan y
women and
en términos de
girls
crisis
and people
humanitarias pues esto
menstruating. And in terms of
todavía
humanitarian
se
crisis, this
potencia mucho
uh,
más, ¿no? O sea,
is still
los
even
estigmas, tabús,
much
la
worse in
parte
the taboos, the
la movilidad
stigma,
constante y
the
no
constant
tener acceso
mobility and
a
not having access
instalaciones,
to
a materiales
facilities,
que les
to
permitan gestionar
materials that
su
will allow
menstruación de
them to
manera
manage their menstruation in
eficiente,
an efficient
condiciones de
manner,
hacinamiento que no permitan a
overcrowding
niñas y mujeres
conditions that do not
tengan la
allow
privacidad
girls
necesaria
and women to
para
have privacy,
gestionar su
such as to
menstruación,
manage their
los síntomas que
menstruation,
pudieran
the
tener
symptoms that
niñas y
they might
mujeres y la
have,
falta de acceso a
and the lack
servicios de
of
salud
access to health
en los
services
lugares
in
donde se albergan
the places
o
where
durante su
they
trayecto,
are or
pues todo
during their
esto tiene un impacto
journey.
muy,
So
muy
all this has
negativo
a very, very negative
pues
impact
la
in
población en movilidad.
the
Entonces, desde
population in
UNICEF
mobility. So from UNICEF,
asumimos esta
we
problemática basándonos
take
en los
these problems
compromisos básicos para la infancia en la acción
based on the
humanitaria,
basic
¿no?
commitments
Teniendo
that we have
como
for
pilares estos
children in the
cuatro
humanitarian
ámbitos.
action,
Por una
taking
parte, la
these
salud
four
física,
pillars: one,
emocional y mental, la
mental,
protección
physical health,
principalmente
mental
de las
health,
niñas y de sus
protection,
familias
particularly
en
of the
términos de
children and their
violencia sexual
families
y
in
de
terms of
género,
sexual and gender
garantizando
violence,
servicios
guaranteeing
de
vital
dignidad,
and
perdón, como
dignified
alimentos,
services like food,
kits de higiene, en los
hygiene
cuales
kits,
se incluyen productos de
in
gestión
which we
menstrual,
include
productos,
menstrual
servicios
hygiene
adecuados de
products,
almacenamiento y higiene,
adequate
y
services
finalmente
for
la
water
educación.
sanitation and
Apelamos por
hygiene,
la
and
asistencia
finally
escolar
education.
y que
We
dentro de estos
protect
espacios
or
cuenten
try
también
to
con pues,
uh,
lo que ya
take
mencionaba
care of their
anteriormente,
attendance
insumos,
to school,
servicios,
and
pero
we try
también
to
disponibilidad
that these
de
spaces have
materiales sobre
input services,
educación
but
en salud
also
menstrual.
materials for
Estas son
education and
algunas de
menstrual
nuestras
health.
acciones
These are some
específicas,
of
¿no?
our specific
Evaluamos las necesidades y los
evaluate
desafíos
the needs
relacionados
and the
con la salud y la
challenges
gestión
related to
menstrual
the
dentro de espacios
menstrual
en los que
health
se albergan las personas,
aspects in the
centros de
spaces where
acogida,
people
también instancias
are,
administrativas en donde
administrative
pasan
offices,
pues bastante tiempo las
shelters, or
personas
administrative offices
relacionados
where
con los
people
trámites
spend a lot of time
migratorios
when they are doing
para
their
conocer un poco
migration
cuáles son las
paperwork,
situaciones de
to
infraestructura
get to know
WASH
what are
en
the
términos de
WASH
acceso a insumo y
infrastructure
también sobre
conditions in
todo
terms of
cuáles son
access
las
to
experiencias
inputs, and which are the
vivencias que tienen
experiences
las niñas y
that
mujeres
girls and
en
women
cuestión de
have
movilidad
in terms
en
of mobility in terms, once more, of access to these
y cómo manejan su
services and
menstruación.
how do they manage
Y
their
justamente el
menstruation,
tema de
and
acceso a
actually
servicios e
the
insumos
access to
construimos y
inputs and
rehabilitamos
services. We built and we
la WASH
rehabilitated
con perspectiva de
WASH
género para
infrastructure with
garantizar
gender
pues
perspective to
privacidad
guarantee
y el acceso
privacy and
básico
access,
para
basic
hacer una
access
gestión
to
adecuada, la
make an
instalación de
adequate
puntos rojos y
management,
distribución de
the
insumos y kits
installation of red
menstruales
points and
y la
distribution of
capacitación del personal
menstrual
administrativo de
kits
albergues
and
y
inputs, and
autoridades
also working with
migratorias y pues
shelters,
también
migration
a nuestra
authorities,
población objetivo
and
que son
our
niñas,
target
mujeres y
population,
personas
children,
migrantes
women, and
en
menstruating
situación de
people
movilidad.
in situation
Y
of
para cerrar mi
mobility. And
presentación,
to
me
close my
gustaría dejarlos con
presentation,
estas
I would like to
reflexiones
leave you with
finales.
these final thoughts.
Por una parte, es importante
On one
seguir
part, it is
fortaleciendo los
important to
programas
continue
de WASH y
strengthening
de
the
salud
WASH
menstrual,
programs and
¿no?
menstrual
Esto
health
pues para
programs as
generar
well. It is important to generate
evidencia sobre la contribución que
evidence
tienen
on the
estos servicios
contribution of
sobre
these
la salud y sobre
services
el bienestar
to the
de
health,
niñas, mujeres y
well-being
personas menstruantes
of
y con
girls, women, and
con miras
menstruating
a
people
seguir apoyando
in
este
order
tipo
to
de
try to
programas.
continue
Es importante
supporting this
seguir
type of
abriendo y
programs. It is
normalizando la
important to
conversación,
continue
reconociendo
opening and
que la
normalizing the
menstruación es un tema de
conversation,
salud
recognizing that
y de
menstruation
derechos
is a
humanos,
health
¿no?
issue and
En
human
este
rights
sentido, pues
issue. And in
resumiendo,
this
pues hay que
sense,
seguir
it is
creando
important to
capacidades
continue
de
creating
todas las personas que
capacities or
están
building
relacionadas
capacities in all
con
people
la provisión de
related
servicios,
to the
con la
provision of
educación,
services,
con
education,
garantizar
with guaranteeing
albergue a las personas en situación de
shelter for
movilidad.
people in situation
Se
of
debe incluir
mobility.
a todas las
We
personas.
should
Ya lo
include also
mencionaron
all
Gracia, no es
people.
un tema
Gracia has
únicamente de
already
mujeres,
mentioned this. It is not only about women,
los varones, niños y
boys,
adultos pueden
men,
jugar
and
un rol muy
adults,
importante
and boys. They can all
pues,
play a very
en
important
garantizar
role
una adecuada
in
salud menstrual
guaranteeing
para
an
niñas y
adequate
mujeres
menstrual
y
health for
convertirse
girls and women.
pues, agentes de
Um,
cambio,
that
en
can become
convertirse
health agents,
en
that can
personas que
become
apoyan y
people that
entienden sobre este
support and
fenómeno y en este
understand this
sentido pues
phenomena.
construir
In
un
this
entorno más
sense, we
positivo
can build a much more
para
positive
ellas.
environment for them.
Creo que sería necesario también
It
continuar
is also
apoyando
necessary to
procesos
continue
subnacionales
supporting the
específicos,
subnational
¿no? Aquí
processes,
en
specific
México,
subnational
pues
processes
hemos
here
tenido
in
dos
Mexico.
estados
Well,
con
we have
condiciones
32 states
muy
with very,
diferentes en
very
términos
different
de
conditions in
apertura, en
terms of
términos de voluntad
openness, in
política.
terms of
Entonces,
political will.
casi que
So
tenemos que ir
it's
estado
like
por estado para ir
we
abriendo
need to
estos
go state by
espacios y
state,
priorizar,
knocking
por
at their
ejemplo, en
doors to
torno
open
a
these
la salud
spaces and
menstrual.
prioritize the agenda
Y en
around
este mismo
menstrual
sentido,
health.
pues
And
la
in
serie
the
de
same
experiencias
sense, the
resultan pues fundamentales,
advocacy
¿no?
is
Hasta
very
ahora,
important.
si bien se ha legislado en
So far,
torno
even
a
though
este
we have
tema,
had
pues
some legislation about this
falta
topic,
como accionar
we
esta
still
parte de los
need
presupuestos y
to
los programas
uh,
específicos
have more
para hacer
specific
operativo
budgets and
lo que
programs to make
señalan las
operational what
reformas
the
y las
reforms
leyes que hemos
indicate or
venido
the laws that we have
impulsando.
been
Entonces esto también
promoting.
resulta
So
muy
this
importante.
is
Y
also
aquí
very
también les dejo
important.
como los
And here
vínculos a
I'll
estas publicaciones que les
leave
mencioné,
you with the links to these
nuestros
publications that I
manuales
have
sobre salud
mentioned, our
menstrual,
manuals
esta
in menstrual
publicación
health,
también sobre
this publication
menstruar
on
en la frontera sur, en donde
menstruation in the
analizamos
south
algunas
border, where we
situaciones de albergues
analyze
y
some
escuelas con
situations of
población
shelters and
migrante
schools
y
with
también
migrant
el link a
population,
nuestra
and
encuesta
the link
nacional
to
sobre
our
gestión
national
menstrual.
survey on
Espero que
menstrual
sean pues
management. And I
de
hope that
utilidad para
this would be
todas
useful
ustedes. Y
for
pues
you
muchas
all.
gracias por el espacio
So thank you
y
very
quedo
much for
atenta a
the space,
cualquier
and I will
duda
be here for any
o
question that you
seguimiento que
might have.
requieran de mi parte.
Muchísimas gracias, querida Viridiana, por tu presentación.
Thank you very much,
No nos
Viridiana,
queda
for your
más que
presentation.
felicitarlos por todo el trabajo que ustedes han
Congratulations on the work that you have done. It is really essential that people, everybody, are trained and actually educated with regards to menstrual cycle. How does the body work? How to manage menstruation in a healthy and safe manner, and also generate evidence so that decision makers at every level would consider programs that contribute to guaranteeing or ensuring the rights of children, adolescents, women, and everybody really, all the menstruating people, and to also be able to assign the resources that are required, an adequate budget to do this work. Here from Horas Conju, we say that without budgets, there are no rights. So we need to try to advocate and contribute to the work that you are doing, and that we all are doing in some way or the other with regards to this. Please, we would like to invite you to remain in the room in the extent possible to answer some questions that we are already receiving. And now, next, I want to welcome.
Se filtró algo. Me permito darle la más
I
cordial
would like to
bienvenida
kindly
a
welcome to Inés Verónica García.
preguntando algo, Rob. ¿Hay ¿hay una voz? Ok, no sé. Ok. Entonces me voy a permitir nuevamente, mil disculpas,
Okay.
presentarla a Inés
Sorry,
Verónica
again, I would
García.
like
Ella
to
es socia
introduce
Rotary Club del
Inés
Constitución
Verónica Garcia, a member of the Rotary Club
dice que
from
cuando las
Constitución Argentina.
mujeres
She
vinieron
tells
a
us that
levantar
when
proyectos
Rotaries joined
relacionados con salud
to
menstrual y
create
crear
projects
este
related to
grupo de
menstrual
acción
health and
en abril
create
del
this action group
2020,
in April
Inés, por
2020,
necesidad del
Inés,
significado de estos
convinced of
proyectos,
the
decidió
meaning of
trabajar
this
en ellos.
project, decided
Inés
to
forma
work on this.
parte
Inés is part
de la junta
of
directiva
the
y es la
board of
tesorera
directors, and
del
she is the
Rotary
treasurer
Club.
of the
Además,
Rotary
lidera
Club.
los proyectos de
She
salud
also
e
leads
higiene menstrual en
the
su distrito para
menstrual health
mujeres
and
en situación de vulnerabilidad.
hygiene
Ha
projects
brindado
for
charlas motivacionales
vulnerable
en
women.
su
She has
distrito
given
en otros
motivational
distritos de
speeches
Rotary,
in her
así
districts
como en
and
el
other
Grupo
districts of
Internacional
Rotary, as well as
Mujeres
in the international
Rotary al
group
que pertenece.
Women in
Como
Rotary that
ponente
she belongs to.
en la
She was a
convención
speaker in
del
the
Rotary en
convention,
Houston del
the
2022
Rotary
durante
Convention
una
in
sesión
Houston
de trabajo
2022 during
como
a
miembro del
board
Grupo de
session
Acción
as
del
member
Rotary
of
para la
the
Salud e Higiene
action group
Menstrual
for
a cargo del
Rotary group of action
seguimiento de
for
proyectos
menstrual health
internacionales.
and hygiene,
Ella es
in charge of the
presidente del Comité
international
de Salud e
projects. She
Higiene
is
Menstrual
chair lady of the
de su
Committee
distrito
of
para los periodos
Menstrual Health
22-23
and
y
Hygiene in
ahora
her
23.
district for the
En su vida
2022-2023
profesional, ella es contadora,
period, and now
consultora
2023 and
nacional e
24. She
internacional,
is an
socia y
international
directora del área
consultant, partner, and
consultiva de la
director of
firma
the
familiar en Buenos
taxation
Aires y estudios muy
area of
asociados.
Firma Familiar in Buenos
Se ha
Aires.
desempeñado como
She has
docente en la
performed as a
universitaria en la Universidad Católica de
professor,
Argentina,
university
de la
professor
cual
in the
es
Catholic
egresada.
University of
Es casada
Argentina.
hace más de
She
30 años y
graduated
tiene
from.
3
She's
hijos.
married for
Adelante,
more than
querida
30
Inés,
years,
por
and she
favor,
has
tu
three
presentación.
children. Inés,
Bueno,
please go
muchísimas
ahead.
gracias por la
Hi, thank you very
presentación
much
y
for
de
the
verdad muchísimas
presentation.
gracias por
And the
armar este
truth is that
webinar
thank you
que
very
ha
much
sido
for
tan
creating this
interesante y
webinar that has been
que
so
lleva también
interesting
un pasito
and
más
that
adelante en un tema
takes us
tan importante como
one
el que
step
nos
forward with
compete.
such an
Yo
important
voy a empezar
topic
a compartir pantalla, así hacemos esto
that
un
we are
poquito
discussing. I'm
más
going to
rápido.
start sharing my screen so that we make this.
Principio.
Se
Okay,
ve
let me.
perfecto, hay que ponerlo en modo pantalla nada más.
Yeah,
Perfecto, allí
it looks very
estamos.
well. It looks very well. Great.
Bueno, pero íbamos un poquito más atrás. Yo quería
Okay.
empezar antes la presentación. Vamos a ir hacia atrás, que tenemos un poquito más de views. Antes que nada, yo lo que quería contarles
First of
en
all, what I
breve,
wanted
muy
to tell
chiquitito,
you in
es
brief and very rapidly
el-
is
vamos a empezar desde aquí, entonces. Quería contarles esto.
I wanted to tell you and share with you the following.
Cuando nosotros decidimos hacer
When
este
we
grupo de
decided
acción,
to
que
create
fuimos
this
un grupo de
action group,
rotarias,
it was
que
a
nos
group of
encontrábamos
Rotary
a la
women
situación de que en Rotary
that
esto no se
we
hablaba,
were
en
in a
Rotary no se
situation
hablaba
in which in
de esta
Rotary they were
asignación
not
pendiente
speaking
del
about
puesto de
this.
las mujeres. Decían, no,
Rotary
tanto
didn't
tiempo que Rotary había
discuss this,
incorporado a
no?
las mujeres en el mismo rango de los hombres en todos los Rotarios del
It's
mundo.
since some
Esto
time
fue
ago,
algo que
Rotary had
hace
incorporated
tiempo
women with the
perdido,
same rank
20
of
años
men
absolutamente
in all
nada.
over the world,
Y muchísimo
and
más atrás quedaban temas como este. Como
there were
ya
some
nos
topics like
explicaron
this one
las
that were not
presentadoras
discussed. However,
anteriores,
as
y
the
muy
previous
bien lo han
speakers
hecho,
explained,
toda la parte
and they have
teórica
done
del
this very
por
well,
qué, del
they
para
have
qué, de las
mentioned the
cosas que
theoretical part of
advirtieron y
why
las
the things that
estadísticas.
were noticed, the
Todo
statistics,
esto había llegado a nuestras manos
all of
y
these
nos
came to our
planteaba
hands,
esta problemática de la
and
que
we have
una
this problem,
organización tan
right?
importante como
That
Rotary, que
an
es la
organization
ONG
that is
más
so
importante del
important as
mundo,
Rotary, the most important NGO in
todavía
the
no
world,
había tomado
was not
conciencia.
yet
Entonces,
becoming
nuestra
aware of this.
primer
So our
acción y
first
nuestro primer
action and our
desafío
first
fue
challenge
la toma
actually
de
was
conciencia. Y esto lo hicimos a través de
raising awareness. And this
una
was done
herramienta que
through
teníamos
a
que
tool
era
that we had,
un
which
action group,
was
es
an
decir, un
action
grupo de
group.
acción. En
That
Rotary
it's
existen
an
grupos de
action group,
acción
as its name
para
says.
muchísimas
Actually, in
problemáticas. Hay
Rotary, we
28
have
grupos de
action
acción
groups. There
que
are
tratan
28 action
problemáticas
groups
desde
for
salud
different problems,
materno-infantil, que tratan
maternal
problemáticas de
and
medio ambiente, de problemáticas
problems,
de
environmental
migrantes, de la
problems,
paz, etcétera,
migrants
etcétera.
problems, peace, well, so
Decidimos
many things.
proponer
So
crear
we
un
decided
grupo
to
de acción
propose the
especial
creation
para
of
toda la
an action
problemática
group
de
special for
MHG, que es salud
MH
e higiene menstrual.
uh, health, well,
Tuvimos la gran
menstrual health
suerte
and
de
hygiene,
lograr despertarnos
MHH.
conciencias y que en
So
la
we were
directiva
able
nos
to
dieron el
receive
ok
support,
rápidamente. Y
and
en el
the leaders
2020, bueno,
accepted. And since
dimos nuestros
2020,
primeros
we
pasos.
started making our first steps forward. What I bring you here is these are projects that have already been implemented. What is our function? Our function is to help all those organizations that want to put in practice the health in menstrual health and hygiene, empowering of women in given communities that they would want to get there. For them, we have all the know-how and all the projects that have already been done, as well as information on the success and the mistakes that were made as well in each one of these projects. We have all of this information for whoever wants to start implementing these projects. And now I want to share with you some of these projects. Among the projects all over the world, we have found some of the flagship projects for us, like in Mexico, for example, RILA. This was Encounter of Young People, and the girls under 18 decided that this was a topic that was very important for them, that they wanted to take to the communities, the most vulnerable communities. I mean, these girls that they had access not only to knowledge of their bodies, but they also have access to money to buy the products. They wanted to help those that couldn't do this. So they invited this, which was called simply It's Coming, Ya Llega. And this, they went to the vulnerable Mexican communities with this project with physicians and speakers specialized in this, and they took in these little bags the clothes, pads, to give it to people in the vulnerable communities that couldn't afford to buy these kind of things. We had this group of girls, and in the middle part, the coordinator, Veronica Lozano, that made this possible. I wanted also to highlight that in this same project, there was an important issue that has to do with the creation of these, the sewing of these pads. Volunteers, Rotary volunteers did hundreds of these pads to give them to the girls of the community that was going to benefit with this project. This is another project also in Mexico. This was for much younger girls, as you can see here. And in this project, we started working on the bodies of the girls through drawings, through little books that were targeted at these very young ages. We told them what was going to happen to them later on in their lives. This was a project that was done especially in Ciudad Juárez. Let's go to the other side of the world now, and going fast for you to have time for questions. And in Africa, there were so many projects that we have done as well. There were projects like this one, which were aimed at women and men as well. My colleagues also spoke about the men, because it is very important to include men in these speeches, in these presentations, in these topics, because they are the ones that have the least idea, but they are the ones that are the ones that will be with these girls or women, and they will feel ashamed about talking to them. There were even men trainers here. And the first thing that we recommend is that there is a educational presentation, so to say, and then you can continue with talking about access, and then you can continue talking about sometimes the way in which we can take this access to the different countries or the different communities. And this is one of the ways. It is very interesting, actually, because through this program, we taught the girls how to make these pads. And what Rotary did for this was to look for sponsors to provide the first sort of money, the first injection of money to buy all these machines that were necessary for the girls to be able to learn how to sew or make up these little pads. Not only for, the idea was that they didn't only do pads for themselves, but more for other girls that needed these pads because they didn't have access to other type of products. And actually, other types of products might be contaminated, and we know about that. But we focus first on people that cannot
no están
buy
pensando en contaminar o no
or are not,
contaminar, sino que
they
están
are not thinking
pensando
about
en qué
contaminated or
hacer ese
polluting.
día
No,
que no
they
pueden ir al
think
colegio,
they are
que no pueden
thinking in
salir de
what they are
casa,
going
que
to
no
do that day,
pueden
that they cannot go to
tener lo
school,
que
they
otros
cannot leave
niños
school,
tienen.
they cannot have what other
Fue
girls
un
have.
proyecto
This was
interesantísimo
a
porque
very
las chicas se
interesting
sumaron
project
muchísimo,
because
multiplicaron por 7, cada una multiplicó por
no,
7
every girl, the Romani
know-how.
girls
Así que
that
imagínense que quienes
were
tengan ganas de
here,
hacer
they
un
wanted to
proyecto
work in this
destinado a
project,
esto,
and
esto es
they
un proyecto que
finally
va
were able to
a tener
disseminate
un
information
impacto enorme.
7 times more. No?
Si
So
volvemos
these
también a
projects have
los
very low
niños
cost and are
en
very good.
África,
If we go back, well,
aquí
this is
hubo
Africa,
otra
still Africa. Here,
concientización
there was
respecto
another
de los proyectos de Menstrual Health and
process of
Hygiene, y
awareness
allí fueron los
raising. Here you
responsables
have
de
these
ese
people
proyecto.
are those that were in charge of the project for awareness
Fueron
raising.
muestras de cómo
These
quedaron
are
las toallitas que
the
confeccionaron.
pads that they themselves
También
make,
quienes
they themselves
otorgaron
make.
en esta
They also give
segunda tanda, digamos
in
así,
this second group of people.
productos
They
que,
also
bueno, que
provided
no eran las
these
toallitas
people
estas, sino que eran
with
los
other products that
productos
were not the pads,
de,
but they were
reutilizables, pero que eran
reusable
copas y que
products,
fueron
but
destinados
cups,
no a
cups
las
that
niñas,
were
sino que fueron destinados
given not for
a
the
las
girls, but they
mujeres
were
pobres.
given to
¿Sí?
young women.
Como dijeron mis colegas
As my
antes, en
colleagues
África hay
previously
un
have
montón
mentioned,
de ayuda
in
respecto de que
Africa,
se puede llegar a los colegios con
there's a
este
lot of
tema. Y
help, and it
entonces
is
se
really easy
concientiza
to
tanto a los
be able
varones
to
como a
get to
las
schools
chicas
with this
de los
topic. So
colegios
you raise the
secundarios
awareness of
y
both girls and
es un
boys in
approach muy
high schools.
interesante
And this is a very
porque
interesting approach, really,
justamente
because
el tema de
actually
la
this
vergüenza que sienten
issue of
algunas de
the
ellas
shame
cuando
that
se
some
encuentran que
girls
les está
feel
pasando
when
algo
they are
que se han
experiencing
manchado,
their
algún tipo
menstruation, if they
de
have
problema que hayan
spot
tenido,
or if they have
dejan
any problems,
de sentirse tan mal porque los chicos tienen. Es
when
impresionante cómo reaccionan ellos
when the
ante
boys know
situaciones
about
como
this,
esta,
they girls do
llevándolas
not feel that
después de haber
ashamed, no?
recibido charlas de
And
este tipo.
it's impressive how after talking to them, they even help
Aquí están las
the
capacitadoras
girls in the
mostrándoles
class. You know, if they have some problems
productos,
here,
¿no?
we have the trainers showing the
Los chicos,
products.
bueno, los chicos, los
Well,
que nosotros llamamos rotaractianos, que son aquellos que
the
son mayores de 18,
Rotarian,
no menores
those
de 30, 35, que también se engancharon en el tema y que hicieron
from 18 to
acción
30 years of age, they
en otro
also
distrito.
were part of this, and they did the
Y
same
ahora nos
actions
vamos
in
para
a different
India.
district. And then
Y
let's go
aquí
to India.
tenemos una de
And
nuestras
here
ginecólogas
we have one
estrella,
of
que es
our
la doctora
stars,
Mirashi, es una
gynecologists,
ginecóloga muy
Dr.
conocida en
Amirashi,
India,
a
que
gynecologist that is very well known in
se
India.
dedica ahora por
And she
completo a este
has devoted now
tema
full time
y va dando
to this
charlas
work. And
por
the
todas las
menstrual
partes de
health,
India
and she
y
goes through
en
all
todos los
schools
foros
in
en
India
donde la llaman
to
y
give
es la que
speeches,
explica
and she
técnicamente
is the one that
los pros y los
explains
contras de
technically
cada
the pros
método
and
y
cons of each
está muy
method.
abocada a
And she is very much
que se
focused
utilicen para no
on
contaminar el
um,
ambiente y
the use
además
of
para
products that do not
concientizar
pollute
a
the environment.
todas
And
las
she
nuevas
also wants to raise the
generaciones.
awareness of all the new generations.
Este es en Chennai, que es donde
This is
estaba ella.
Chennai, which is where she was.
Como verán, son chicas bastante
As you can
chicas.
see,
Creo
these
que
are very, very
aquí
young
nosotros
girls. I
llamamos
think
los primeros años del colegio secundario, 12,
these are
13
the
años.
first years of secondary
En
school,
Chennai hubo
12,
varias
13 years of
acciones
age.
y
No,
llevaron a
in
miles y miles de niñas. Los
Chennai,
números
the actions,
en India
they had
son
thousands of girls. The
increíbles,
numbers of India are incredible, as you might
enormes.
know. And we had so many girls
Acá es
there.
donde en otra de
This
las charlas,
is
pero ya
in
dirigida a gente más
other
grande,
of the speeches, but this is for for older
le
people.
hace tomar conciencia
We try to
y además
raise
se distribuyen los packs.
their awareness, and we also distribute the
Fíjense
packs.
cómo se puede además
Look,
hacer uso
you
de
can
un
see
montón de
here how can you
sponsors y
use
esto no
any
lleva tanto
sponsors,
tiempo
and
como
this doesn't
parece
take
y
that
es
much
tan
as it
difícil de
seems,
conseguir
or it's not that
para
difficult to
no
get.
necesitar
You
tanta,
so that you don't need
digamos, tantas manos que vayan a juntar dinero, sino que
so
simplemente
many
buscando
hands going to
empresas
look
que
for
se
money, but maybe
asocien
you can
con
look for
ganas a
companies
este
that can
tema,
associate, that are
podemos
linked to
juntar los
this topic in
sponsors
some way. We can
necesarios para que se haga posible
talk
la
to them and
distribución
have
a
the
mayor
necessary
cantidad
number of
de
sponsors to be able to distribute these products to a larger number of
Y acá es
girls.
donde, bueno, ahí
And
dice, the
this
future
is,
of the world is in this
it
classroom, que es
says
el
the
futuro del
future
mundo
of the
está
world is in this classroom,
en
right?
esta aula, que es un poco de lo que estamos
It's
hablando.
kind
Ellos
of
son
what
el
we're talking
futuro
about. They are the
y el
future,
futuro
and the
de este
future
tema está
of this topic is in them as well. And there you have the group of boys that in this school they were in different classrooms, but they joined all together so that they could give the speech to everybody in the same room. This is a foundation that does the same, that it's Go Hygiene. That's the name of the foundation that also uh, provides this information. We were very lucky to be part of a forum, the first Latin American forum on menstrual health and hygiene, in which there were projects uh, presented, and it was pretty interesting, really, because we were able to reach many, many people in Mexico. Well, personally, I know many of the ladies that are in charge of these topics, and I know of the great qualities they have, and I know how they have managed to change the life of so many.
Nuestro grupo, a lo largo de estos años de existencia, del 2020 hasta hoy, organiza mensualmente conferencias y charlas con distintas personalidades alrededor del mundo. Estas son algunas nada más, que nos hablan de su expertise y que, digamos, hablando de su expertise, tocan en algún punto esta temática y cómo la pueden llegar a poner en agenda dentro de sus propias charlas. Si hablamos de Argentina, se llevó un proyecto piloto que fue en las afueras de la ciudad de Buenos Aires. Aquí en Argentina se llama Buenos Aires. Bueno,
Some
Buenos
of the
Aires ciudad es
presentations
una cosa. Luego las afueras de Buenos Aires, y
Buenos Aires.
a muchos kilómetros de Buenos Aires hay comunidades
Many
que son
kilometers from Buenos
chicas,
Aires,
más
there are
chicas,
communities that
y
are
con
smaller
población más
and with
vulnerable, ¿no? En la ciudad
more
de Buenos
vulnerable
Aires,
population. In the city of
quizás es
Buenos
muy difícil
Aires,
encontrar
maybe it's pretty
población que
difficult to find
necesite
populations that
estas
need
acciones.
these
Pero sí
actions.
corriéndonos unos
But
kilómetros
if
más
we
afuera
go a
vamos a
little,
encontrar.
some
Y
kilometers
así
away from
llegamos a
Buenos
una
Aires, we will
conclusión
find these populations.
importantísima
And
que
here
tiene que
we
ver
reach
con
a very
que en
important,
estas comunidades
the,
había mujeres que incluso siendo madres jóvenes no habían tenido nunca una consulta a un
they
ginecólogo.
never had, some
Así que
women never had a
se las introdujo. Allí hay una
appointment with a
médica veterinaria
gynecologist. So we
que fue la
introduced them to
encargada
this. We had a
proyecto,
physician that
se las
was in charge of the
introdujo no
projects.
solo
We
en lo que
introduced them
tenía que ver con el proyecto en sí
not only
mismo,
with what had to do with
sino
the project
con
itself,
las
but
primeras
also with the
consultas
first
médicas
medical
de la que luego salieron que
consultations that
algunas
they had.
tenían algunos
And
problemas
some
con
of
las
them had
recetas. Así
some
que
problems,
sí se puede
serious
decir que se han
problems. So
salvado
we
vidas
can
a
say
través de este proyecto.
that we have to save life with
Y
the
allí
projects.
este fue un proyecto en la cárcel
And
en
this was a
donde, como
project
dijo
in the
una de las
jail,
oradoras que me
as one
antecedió,
of
a
the
veces hay
speakers
problemas
that talked before me.
transaccionales
Sometimes there
para
are
obtener
transactional problems to obtain products
la higiene menstrual mes a
for
mes.
menstrual hygiene
Y lo
month
que
to month.
intentamos desde
And what we
ONG es
try
que
to do
esto
from our NGO
no lo
is that
tuvieran que sufrir más y
they
por
didn't have to
tanto,
suffer this
además
more.
de
And
darles la
therefore,
charla, este proyecto
apart
lo que
from
quería era darle el acceso a un
giving a
producto que durara
presentation, this project
2
wanted to give
años,
them
4
access to a
años,
product
5
that could
años.
last 2 years, 4 years, 5 years. We know
Más
that
o
the
menos
cups
entre
last
5 y 10.
5 to 10. We know that the
Tela
pads,
duran
the
alrededor de 2
clothing
años,
pads
no
last like
contaminan el
2 years.
ambiente.
They do
En
not
este
contaminate the
caso,
environment, but in
tenía
this
que ver
case,
con
they had
subir la
to do
autoestima de estas
with
señoras y
increasing the
poder
self-esteem of these ladies
evitarles
and to
esa
prevent these
posible transacción.
possible transactions.
En Alemania, los chicos hicieron, los de
In
Rotaract
Germany,
también, hicieron
the
durante un año
Rotarian
entero
boys, for 1 year, one
colectas
whole
en
year,
todos
they
los
made
lugares bailables, en
uh,
todos bueno,
collections of
los bares, los
money in
clubs,
all the bars, the
y
pubs,
luego de
the
tener
discos,
esta
these places.
colecta,
And after collecting
que
this
le
money,
llaman la
they call it
tarjeta social campaign,
the several social campaign. That's
juntaron
how they call
bastantes
it. But
fondos
they
para
raise
hacer
funds
una
with
ayuda
this
muy
to
interesante
provide very
a
interesting
una
help
comunidad
to a community in Africa.
y un logro que hicimos muy
And an
importante es que todos
achievement
los
that
años
we had,
un
very important
día
one, is that every year,
que se llama
one
el
day, we
mundo
have
se
one
pone en
day that
Rotary
it's called Sun Never Sets in
durante las
Rotary.
24
During
horas
the
de ese
24
día, que
hours
empieza
of
en un
that
lugar del mundo y
day,
termina en
they
otro,
start in one place of the
hay
world and
cada
end,
hora
it starts in one place
una
of the world and
escena
ends in
de
another. But
alguna
for
acción
each
importante
hour,
que
we
se
have a
hizo durante ese año en
presentation of some
Rosario y tuvimos
important
la
actions or
suerte
activities that were done during that
que se
year
les
in the Rotary
incluyese
group. And
y
we
nos
were
dieran
lucky
una
enough,
hora
and
de
they
las
included us,
24
and
que
they
fue
gave us 1 hour of the
muchísimo.
24
Y
hours.
esto
And
de
this
mucha satisfacción porque
gave us lots of satisfactions because we really feel that we have raised awareness, which is the first thing that you need to do in this context, in this situation. Thank you very much. I hope that I've talked for a short time, but something interesting for those of you who might be willing to implement some project. This is my contact information and the contact information for our action group. And thank you very much, Clara, for making this possible, and to everybody here as well. Thank you very much. I must tell you, Inés, how proudly Rotary I have to recognize and congratulate the great work that you are doing, that the group is doing, the group working in menstrual health, and that you represent at this point. It is really crucial to guarantee the access to menstrual products like pads, sanitary pads, and everything that you have mentioned, the lack of this product, which leads to health problems, which really has an impact in the daily life of people, apart from that very important work that you do, providing emotional support that is so important for the mental health of people, and to overcome all these barriers that we have with um, health and access to all these services. This webinar really, as we have always said, is part of a cycle of webinars that we've been developing. And I want you to know that at this point, Dr. Maria del Carmen Galleno it's not here. She's also a Rotary, actually, and she, by her insistence, is that you were invited, so I don't want to take the credit that you are here, because it was her really who participated and invited the Rotary Club, because she knows very well that work that you have been doing. Thank you very much, and thank you that you have turned on your camera, because I have not few, I have many questions, but we will choose some of them very rapidly. Some questions that we have received. But before, we have to thank all the people that are connected, both from the public academic sector and the private sector, the ministries of health, particularly Argentina, Bolivia, Brazil, Chile, Colombia, Cuba, Ecuador, Spain, Guatemala, Honduras, Mexico, Nicaragua, Paraguay, Peru, Dominican Republic, Uruguay, and Venezuela, that have helped us through Facebook and YouTube Live. We have received many congratulations for our speakers, and also some questions as well that I'm going to do right now. Well, let me 1 second to organize the questions here. And we have to follow. There is one question. This is for you, Gracia. How do you apply in Peru the pediatric services if the toilets are limited in these services, in general, in public service or educational services, even for health professionals? What legal provisions are considered, or do you have in Peru for this kind of toilets in these places? Please, you have the floor. Well, very good question, actually, because in Peru we are kind of delayed as compared to other countries in the region. In Peru, a law was passed in 2020, the law for the menstrual hygiene management. Unfortunately, this law has not been implemented yet, not at all. But what is interesting about this law is that it considers several aspects, not only the provision of the menstrual hygiene products, it also provides that there needs to be information and promotion of healthy practices around menstrual health, and also the General Directorate of Drugs and Medications should do whatever is necessary to guarantee the quality of these products, and also to create an observatory to monitor what we are doing or seeing, specifically about the conditions of the toilets and restrooms, both in the public health services and education services, as well as access to water, they have not established anything in the regulations in force. But the good side is that we are already working with the Ministry of Health actually to see which are the next steps that we would need to take in a technical standard like the one that we have seen in this presentation that they already have in other countries, and what are the aspects that need to be approached to take care of menstrual health. And in that standard, they are including actually the need to coordinate with the education sector to provide all the guidelines, all the practices to access information and for the improvement of the infrastructure of toilets, because, well, I suppose that several health professionals, we have been in different parts of the country, and we know the situations, particularly in the rural areas, in the remote areas. And even here in Lima, last year I was in a school here in Lima, actually working on this. And well, the students themselves, girls, said that they didn't have the privacy in their toilets. They didn't have water, sewage, soap, and let's not lose sight either of the conditions to eliminate the waste, the garbage. So we have to have a comprehensive approach, and this is pretty limiting. Thank you, Gracia. Ines, given the experience that you have working in schools, what strategies do you consider would be efficient to eliminate bullying, jokes, or the discrimination that might be generated among girls? Well, I can talk about a very difficult case. This was in Africa. This motivated Africa to put this on their start working on this. It was a girl that committed suicide. This was a 12-year-old girl that was spotted. She didn't have money to buy products, and unfortunately she was bullied at school, and she went to the restroom and she hung herself. From there, women of that same community contacted us, and well, we sent them everything that we could send, all the help that we could, but well, this was an extreme case, of course, but these things happen and happen. Not at this extreme level, but there's a lot of bullying. And what is the best strategy? The best strategy is to discuss this as something that is absolutely natural and talk it with the boys and give the boys and the girls, empower them and tell them, you are in charge. You are those that have to protect the girl that this is happening to. You should be protect her. You are in charge of protecting her and taking her to a safe place where she can find another other clothes to put, or whatever. You are in charge of this because this should be taken as something natural, and today it is this girl, but tomorrow it can be your sister or your mother. So this leads to an awareness that it's incredible in boys. And the other case that was very motivating was in Nepal, where after several discussions, several presentations that we did, several speeches that we did, one of the moms came to one of the speakers and told her, I have to thank you because yesterday, after listening to all these speeches, her girl had came back home with 3 boys that were very close to her, and they came and they said, no, we have accompanied her for her not to feel bad because she had a little problem. She's a little spotted, but that's okay. We are taking care of her, and they're very, very proud of this. And the lady that was very, 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 very emotional, she said that these speeches to raise awareness that cost 0, because the only cost is that some motivator comes to a school and proposes to do this. But it is impressive how this awareness reproduces geometrically, this feeling of going from bullying to something that has to be with, let's protect the vulnerable. So if I have to give you a piece of advice, I will tell you, start by this, that it doesn't cost anything. The cost is 0, because many times People say yes, but we don't have money to buy the products. Well, that's a second step. Those that can raise funds and all of that, that's perfect, that's great. But those of you that cannot do this, raise money or that, you don't know how good is this, especially for younger boys, 11, 13, 14 boys. Thank you, Ines. I have two more questions. Well, I have many questions, many, 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 many. But I'm going to do two more questions, one for each one of you. Countries are ready to guarantee menstrual hygiene of men and of trans men or men and women affected by disasters. What are and what are the necessary steps to guarantee dignified menstruation to people affected by disasters? Gracias.
No, si puedes completarla, mira, yo puedo hablar un poco desde
Well,
lo
I can
teórico,
speak
¿no?
from the
Lo que se tiene que
theoretical
hacer
aspects,
tiene
from what needs to
investigación
be done, and if you have
epidemiológica,
experience in
entonces
what
eso es
has
muy
been done.
importante.
So
Mira,
I will be
este
very
tema se
brief.
está poniendo,
This is something
¿no?
that
Y
it's
conozco
been
el caso de Perú y
introduced, and
son
I know the
poblaciones
case of
Naciones
Peru
Unidas que lo
and the
están
United Nations
promoviendo, que se incluya
Population Fund,
dentro de
which
los
is
paquetes de
promoting that this
respuesta
is included
humanitaria
in the packages of
un kit que le
humanitarian
llaman
response.
dignidad,
There is
¿no?
an item that it's called Dignity,
Justamente
which is
está dirigido a
actually,
atender esta
it's
necesidad de
targeted
las
at
mujeres
taking care of
en
these needs
situaciones de
of women
crisis
in situation of
humanitarias, ¿no? Y
humanitarian
población
crisis
migrante
and
también.
migrant
Este kit
population as well.
incluye
This kit includes
jabón,
soap,
gel para lavarte las manos, toallas higiénicas,
sanitizer
incluso
gel,
nosotros le
gel,
llamamos o le llaman paradas o como quiera
or
llamarle la ropa interior, ¿no?
underwear,
Para e
etc., pads.
incluso acá en
And
el país,
even
y yo sé
here
que
in
en
the
varios
country,
países
and
el
I
Fondo de
know that in
Población ha
several countries,
estado
the Population Fund has
abogando
been
por ello, que esto forme parte ya institucional
advocating for this,
de la
that
respuesta en
for this to
situación
be
de de
institutional
crisis
part of the
humanitaria
response in
por parte
situations
del
of
Estado. Es
humanitarian
decir,
crisis by the
que no
state. That
dependamos
is, that we should not
de
depend
las donaciones,
only of
sino que se
donations, but
convierta en
this
una
should
política
become
pública.
a
Sé
public
por
policy.
certeza que en
I
el
know
país
with
se ha
certainty that in the
considerado.
country they have
Todavía no he
considered this.
visto que
I
esto se
haven't
haya
seen yet that
implementado
this
en
has
la
been
práctica.
implemented in practice, though.
Gracias, Inés.
Thank
No
you,
sabría de
Ines.
la parte legal de qué
Well,
países
I don't
tienen
know about the
estipulado
legal
en
part of
sus leyes,
which
esa
countries
parte
have
no la
this in
sé
their laws. That
seguramente,
part I
que
don't
sí,
know.
no lo sé,
Probably
pero sí sé
some
que
might know. I don't
dentro de
know.
Rotary hay
But
un
I know
programa
that
de
in
ayuda a
Rotary there is
refugiados
a program
y que
to
dentro de
help
ese programa se
refugees, and in this
utilizaba también
program
este tema
we
de los
have
kits
also
y
considered this issue of the
cuando
kids.
se
And
iba
when
a Siria
we were
hace un par de
go
años atrás,
we were going to Syria, we were
incluían en
there a
esos
couple of
kits
years ago. They
solamente
included
un
in
pack
these kits
de
one pack
toallitas
of
higiénicas y
sanitary
nosotras
pads,
logramos
just one pad,
convencer
and we
a través de
managed to
unas charlas
convince through some
que
speeches
ese pack le
that
serviría
that
solamente
pack
para un mes
would
y que
be
había que
useful
comenzar a
only
buscar
for
en la
1 month.
posibilidad
And if there
que era
was
mucho
just
más
one woman in the
interesante y
family
casi
group,
al
that it
mismo
would be
costo
much interesting,
incluir
and almost for the same cost,
un pack
they
de
could include
toallitas
a pack
de
of
tela que son lavables y
clothing
se pueden volver a usar, sobre todo en situaciones
pads that are reusable, that can be
como
washed and
run, como
reused,
decimos así,
especially in this
que
situation of
están ahí en las
when they
fronteras
are on the run,
yendo de un lado
they
hacia
are
otro
going from
y
one
esto
place to
sí va
the
a
other.
servir para más
And that
meses,
was
muchos
going
más
to
meses y
be
una copa,
more useful for
porque
more
si
months,
estaban
and a
las
cup,
mamás
because if
familiares,
the
la señora
mom
podía usar la copa y
was
le
there, the
serviría un
mom could
montón.
use the cup, and that
Así
would be
que
very
esa
useful.
es una
So
experiencia que
that
resultó
is an
buena,
experience that
pero ya no
ended
sé
up
desde el
being
país,
very positive. But
no lo sé, no me competiría.
I don't know. In other countries, I don't know. And such as to close this, that you have just said, Ines, what products of what cost-effective menstrual hygiene products would you recommend? And then Gracia as well, that should be funded by the governments. And Gracia, I would ask you to please add to this question, telling us whether you know the progress that has been made in our region and particularly in Peru. You have the floor. Well, we promote as well in our speeches, we promote the protection of the environment. Therefore, we consider that all these disposable products that are the traditional products, like the tampons or the pads, do not really contribute at all with the improvement of the environment. On the contrary, and on the other side, we made a cost study analysis, and although at a first stage it might be more economic to buy that, if you have to buy it every month, they end up being much more expensive than buying a kit of clothing pads that can be washed, that are recommendable for girls up to 16, 18 years. And then it's the cup that it's are being done with better silicone and very good products, absolutely safe because the cup lasts 10 years. You need very little water to wash them, less than one cup of water to wash it. So if the governments could um, in more developed countries, if they could do it, that should be that they should be providing actually to each woman or girl in vulnerable sectors.
Y solamente unas
Okay,
palabras finales
thank you. Just
referente a
some
lo
final words,
importante
maybe to
que ya se ha
complement
dicho, ¿no?
what has
Y
already
es
been
que
said. And
yo
it is
creo
that
que
I
mientras más
believe
opciones
that the
tengamos,
more options
mejor.
we have, the
Y que
better.
podamos
And that
elegir,
the
¿no?
idea
Las
is to be able
mujeres
to choose.
podamos elegir
That
qué es lo
the
que
idea is
más
that
se
women can
acomoda
choose what
a mi
adapts
cuerpo, a mi
better
ritmo
to
de
my,
vida,
what fits
¿no?
better with my body, with
Eso
my
como un principio, que tengamos la
life, with
posibilidad
my
de elegir.
activities.
Y
That
segundo,
in the
a
beginning,
mí
that
me
we have the
parece muy
possibility to choose. And
interesante
second,
la
I think
introducción de
that it
estos
is very
nuevos métodos
interesting the introduction
reutilizables.
of these new
Yo estoy
reusable
sorprendida a raíz de que
methods. I'm
comencé a
surprised
tratar este
since
tema,
when I started to study
a-
about this and
en el
learn about
Perú,
this in Peru,
pese a que no hay una difusión
despite the
masiva, por
fact that there is
ejemplo,
no
sí sé que
mass
muchas chicas
dissemination of
están
this,
usando
I
la
know
copa
that many
menstrual,
girls are
sobre
using
todo
the menstrual cup,
universitarias, ¿no? Porque ahí
particularly
es donde se está
university girls, because
difundiendo
that's
más
where
esto como
this
un
is
tema de
being
que
more
les
disseminated.
acomoda,
Something that
que
it's
la pueden usar
comfortable to
por
them, that it's
largo
something
tiempo,
that
les
they can
permite
use
hacer
for a long
deporte
time. It allows
y,
them to do
y son
practice sports,
ecoamigables,
work out,
¿no?
and they are
¿Qué
eco-friendly
recomendaría
besides.
yo que en los
What would
países
I
pobres?
recommend
Yo te
from
diría todo.
countries to buy? I would say
Todo
a
en el
little bit of
sentido
everything.
para que uno tenga, para que
Everything in the sense that
le
we
podemos dar la
can
opción
give the
a
option
las mujeres a
to
poder
women
elegir. Y
to
solamente
choose.
quiero decir una cosa que me
And I
parece
just
que
want
también
to
es
say
importante.
something that I would like
La primera
that it's
objeción que te
important.
dicen los
Um,
gobiernos y los tomadores de decisión es que no hay
uh,
plata, que no vamos
the
a
first thing is
bajar
that
el
there's
impuesto,
no money,
imposible. Pero
that
ya
we
se
are
han hecho
going to
estudios
reduce the
de
tax
que
impossible, but we've made
lo que los
studies that
países están
whatever the countries
recuperando
are
en
recovering
impuestos,
in
o sea,
taxes,
la IGB,
I
el
mean
IGB o
the
el IVA,
VAT or the
si
sales
destinamos lo que
tax,
se ha
if we
recuperado por IVA
allocate
al
what has been
comprar los
recovered
productos de
uh,
gestión
for
menstrual,
with the VAT
cubre en
to buy
extenso
these
los
products,
requerimientos
it
para
will
atender a la
cover
población
the
vulnerable.
requirements to take
Entonces,
care of the
en el
vulnerable
tema de los
population. So the
números,
issue of
no nos
numbers,
los tenemos que
we do not have to
aceptar como
accept
tan
that
inamovibles,
or
sino que
consider
hay
that
que
this is
generar la evidencia justamente
not
para
movable, but
discutir
we need to
con
generate
estos
evidence to
tomadores
be
de
able to
decisión.
discuss with
Y
these
yo creo que los
decision
métodos
makers. And I
reutilizantes
believe
son
that
a la larga
all the
costo
reusable
efectivos.
products are cost effective. Well, thank you very much. We thanks all the questions that have been done. We won't be able to answer them all, but we will have them always present, both to define new possibilities of webinar or for the work that we do. We value the participation of interest of everybody joining us week after week. To close this space, I want to ask you to be very specific. I want to give you 1 minute to give us a takeaway message. 1 minute, both Inés and Gracia. Go ahead, Inés.
Okay. Bueno, mi mensaje es
My
que
message is
ayuden a tomar
help
conciencia
to
de que este es un problema para gente que
create
no
awareness that
vive
this is a problem for people
como
not
quizás
living
vivimos
as
nosotros,
we might live.
no tiene esa posibilidad y que así
They
como
do not have
nos
this
abocamos
possibility,
muchas
and
veces
as
a darles abrigo, a darles
we
comida
sometimes
y a
focus on
protegerlos
giving them
en
shelter,
una
food, or
vivienda,
protect them,
pongamos en el mismo lugar la
let's
protección que le estamos dando a
also
las
consider
niñas,
the protection that we need to give to
ayudándolas
girls.
con
And
este
let's help
tema,
them
no
with
solo
this
en
topic,
educación,
not only in
sino también
education,
en
but
el
also
acceso.
in
Y una vez
access.
que tomemos
And once
conciencia,
we
miraremos un ratito
become
chiquito
aware
con
of this
quienes
and we
están del
speak
otro lado del
with
mostrador,
those that are on the other side of
eso
the
nos va
table,
a ayudar
that
a
will
colocar en el mismo
help
lugar.
us to
Le
put in the
damos de
same
comer y le
place.
damos
We give
el
them
acceso
food
a
and
los
we give
productos de
them
higiene.
access to hygiene products.
Sí, yo
Gracias.
solamente quiero
Yeah,
invocar a que
I
rompamos el
just
silencio.
wanted
Como
to
dice
ask you to break the
nuestra
silence, to,
colega,
as our
hay que hablarlo.
colleagues have said,
Hay
we
que
need to
romper el
speak
silencio
it
alrededor
out.
de la
We need
menstruación y que
to
hablar
break
sobre
the
la
silence
menstruación
around
sea algo
menstruation, and
totalmente natural.
talking about the
Eso
menstruation
va,
should be
creo
something
que va a
completely
ayudar en
natural.
todas
I
las
think that
áreas, en
that
todos
would
los
help in all the areas and in
elementos que
all
están
the
vinculados
elements that
a
are
la menstruación. Y
linked to
solamente quiero
menstruation. And I
tomar unas
just wanted
palabras
to take some
de,
words
Vamos a
from
Sara, la
Jennifer Zara, the senior WASH director of the World Bank, and she says, invest in achieving menstrual health to allow women and children to reach their top potential is a critical measure to build the human capital of a nation throughout the time. And I believe it is so. Investing in menstrual health is investing in the development of children, adolescents, and girls. Thank you very much. Remember that without budget, there's no right, because if you say right, right? Okay, now, before giving the floor to Marisela Malki, who will close the webinar, I want to thank all the Horas Bonu team that has supported the development of this event. Thank you very much. I don't want to name them one by one because I will forget probably. But thank you very much to everybody that has participated. Now, please, Dr. Malki, your final words.
Gracias, Gloria. Bueno,
thank you, Gloria. Well, I'll start by thanking our excellent speakers, Gracia, Viridiana, and Ines, who have been brilliant in this presentation in the webinar for today with this topic of menstrual health that is a human rights thing. It's not only health, it's comprehensive part of the sexual, reproductive rights. You know, their diversity, right? They have even linked us to the achievement of gender equality and the achievement of the SDGs. They have mentioned about 3, 4, 5, and 12. This is just to have it isolated. It's not something punctual. Everything is related, linked. It's been said that it's not only about women, it's about everybody. We need to include men as well in all this work and in the strategies that we will define or do conduct, as we have seen with clear examples from Rotary, from all the projects developed. How do we do these changes, large favorable changes, when we include boys in this topic? And as Gracia has said, this is something that it's a physiological thing that should be something normal day to day, without myths, without being without covering such a normal thing for girls. And it's been mentioned as well that these demands the states regarding the approach of the stigma, the nocive stereotypes, those discriminatory standards based on gender that should be, we should have an adequate environment for girls and women to be able to be empowered to exercise their autonomy, to make decisions regarding their lives, their bodies, and mainly related to menstrual health. We should try to allow men, women, and girls to have access to justice if these rights are infringed. And sometimes there's a broad consensus then the need of the people need to have a good menstrual health, and for that there are essential elements, actually safe, acceptable, reliable supplies to manage menstruation, intimacy or an intimate place, an adequate place, privacy to change the materials, facilities to wash, and especially information to make informed decisions that have this possibility. Like Gracia was telling us, for example, when she was asking what product or what materials can you suggest, there must be a larger offering so that this can be a personal decision, but always based on information. The comprehensive approaches that combine education infrastructure with products that can deal mainly stigma, right? Which is what we have repeatedly hear about in this presentation. The health policies, they should have priority with regards to menstrual health, with investments that should really reflect this important role that we will have in terms of human rights. This is very important, I think, with what we need to stay, which is human rights, gender equality, thing that contributes to sustainable development. It's been really a very enriching activity for everybody. It is something that we have not discussed previously and that it's necessary to do. We have seen that it should be this way, and we reiterate our appreciation to our three excellent speakers. And I also would like to thank the ORAS team, the Gloria that has moderated this very important webinar, Jadira, Rob, Ruby, everybody. And invite you for next Thursday, 22nd. We are having, well, these webinars all Thursdays, and the topic for next Thursday will be cannabis and global health. We would like to invite you, and we hope that you can join us in this morning. Thank you very much, and see you soon. Thank you.
Hasta luego.
Gracias. Gracias.